Councilmember Klein.
Here.
Chair Price.
Here.
Councilmember Scharf.
Here.
Councilmember Schmidt.
Here.
4 present.
Items that are not on the agenda? Okay. And if there are any members in the audience who would like to speak to items on the agenda, please fill out the speaker card. Okay, that's oral communications. Regarding our agenda, I had requested that item number 4, which is discussion regarding possible procedure to vote to go into closed session, to be deferred to another meeting because of the length of our agenda and the meaty items before us. So,
So moved.
so moved. Is there a second?
I'd vote no.
Second?
Yeah, I guess I would tend to want to leave it and see where we are. It's an item of some interest.
I don't think it takes that one. I could be wrong.
Well, I guess my concern is I had requested that it be moved because of the length of the agenda, and there was some confusion. How is this, the meeting has been noticed, in which direction?
Yeah, so I don't think we're prepared to speak about it tonight. We didn't ask the city attorney to come
Okay.
to the staff to the committee
I'd
meeting.
still vote no. I don't think we need the city attorney.
Yeah. I mean, certainly Jim will be here shortly, and
I mean,
Okay.
it was agendized. I read the packet. You didn't send out an email. You didn't tell us you weren't going to do it. I think it's unfortunate you didn't tell the city attorney to come. I mean, I think it's a failure of staff.
it's fine.
Well, and I take some responsibility here, too.
fine.
So the issue is,
Your
can
call.
it be put on our agenda for our next meeting?
It can.
It can be.
Yeah.
All right, so what do we have in front of us right now?
On our agenda, and you got a 2-2 vote, so it stays on the agenda.
All right,
And we can contact Molly and see if we can get her.
okay, fine. Is there someone else on our staff who could help as well?
Yeah,
Okay,
just a note, when we get to item number 4, we can see
what time it is?
and
Okay,
how late we've gone.
okay, all right, thank you. Okay, the first agenda item, Health and Safety Fund, Stanford Development Agreement related to community partners, Avenidas and Stanford Hospitals. And Minka, could you give us a staff report?
I will. Good evening, Chair Price and council members. I'm here this evening to further the discussion regarding establishing policies and procedures for the distribution of the health and safety funds. The steps we are taking in this segment of the presentation is the community health needs as seen through the service lens of 3 key partners in the community: Avenidas, Lucille Packard Children's Hospital, and Stanford Healthcare. These are being presented to you in order to provide assistance in identifying community health and safety need categories, both its definition and the identification of specific needs in the community. I will give you a quick introduction to these reports and then open up a time of discussion in which you may ask further questions of the representatives of those agencies who are here tonight. I will start with Avenidas. Avenidas provides a wide range of programs and services in the community.
Could I interrupt just for a
Yes,
second?
sir.
I guess I was a little confused about the agenda because the third item actually directs us on what we're going to do. The first 2 items are sort of informational, is that right? Background material that will help us was number 3. Is that the right way of understanding?
That's the way I understood it.
Yes, because a lot of the, the needs assessment and all the material that was sent to us is sort of background and informational.
So we're listening to the Stanford and the Lucille Packard and Avenidas information through the lens of how does it help us answer number 3?
Correct.
Okay.
I think we
And-
all know what Avenidas and the Stanford Hospital do, so you don't need to tell us that. We're all familiar with them.
Right, and item number 2, obviously, there'll be a focused discussion on Project Safety Net and an update on that as well. Okay.
Right, but again, it's in the context of the Stanford funds, not
Right, both of them fall within the overall 4 million that's been identified to date. Okay, so, go ahead.
Would you like me to continue, Councilmember Price?
Well, I think probably at sort of a global level, and then we have a lot of materials in the packet.
Right.
And we also want to give time to both, to our community partners if they want to make comments as well.
Right. It was just a summary of what was in their report, so we
Yeah.
could invite the community partners up at this time, or I can continue with my
Okay.
presentation,
Do
whatever you'd like to
colleagues have a
do.
preference? Just kind of a global overview, not very long, I think is sufficient?
Okay.
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 Much like in the staff report, but just kind of at the global level.
Yes. Okay. So I'll go back to Avanitas, and in their staff report, we asked them to speak to key areas of community health needs of the local seniors, and they highlighted 3 key areas which support healthy aging and aging in place. And as the staff report indicates, that was health and wellness programs, transportation, and engagement. So health and wellness programs, those focus mainly on retaining health through exercise and physical activity, and participation in these classes helps older adults gain flexibility, mobility, and strength. Transportation of all kinds continues to be a community issue that they brought to our attention. And last year, they had a 22% growth rate in some of their door-to-door transportation programs. So that was quite an increase as far as that's concerned. And as an aside, this need for door-to-door transportation for seniors was also something that came up when the Human Relations Commission did their needs assessment several years ago. The third area would be engagement, and you see in their report that they noticed that need, and that is supported by the quality of life assessment that was commissioned by the Board of Supervisors, and they provide a wide variety of programs that engage seniors in learning and activities, and some of them they call clubs, just to try to increase the amount of seniors to come to these activities and to create a sense of belonging. So the Stanford hospitals, both of those entities, conducted very thorough community needs assessments to identify the unmet needs in the community as well as the service gaps, and they do so every year. And they do it in collaboration with many community partners. They gather information regarding via surveys, focus groups, stakeholder interviews, health experts, and analysis of community data. Lucille Packard focused their assessment on infants, children, adolescents, and pregnant women. And the 3 current needs and priorities that they have called forward are improving access to primary health care for children, teens, and expected mothers, providing preventative and education programs with special attention to pediatric obesity, and improving the social and emotional health of youth. And you'll see in the report that their implementation strategy very clearly calls out numerous outcomes and strategy, partners, and tactics to accomplish these priorities. Stanford also, as I mentioned, conducted a very thorough needs assessment. They went down from, I think, 11 needs that rose to the top, and broke those down to 4, which were cancer, access to health care, chronic disease, and unintentional injuries. Then from those 4 major needs, they came forward with 3 major health initiatives that are part of their multi-year strategic investment in the community. And each of these initiatives, just like the Lucille Packard plan, has specific goals and target populations and health outcomes and strategies and partners to address these initiatives. And the 3 that they came forward with were improve the health and well-being of older adults, so you'll definitely see some overlap with Avanitas there. Improve access to care, which is definitely an area that Lucille Packard brought forward as well, and reduce cancer-related health disparities. So again, as I mentioned, there are the representatives from these 3 agencies here tonight to answer more specific questions regarding the needs that they brought forward in the staff report. I believe Sherry is here, so that's good. So those are the 3 key agencies that you asked me to bring forward tonight. If you wish, staff is able to do further follow-up or invite other key community agencies or stakeholders or health experts to a future policy and services committee meeting to aid you in this discussion if you would like. But we wanted to start with these 3 agencies that you requested to hear from first. And that concludes my staff report.
Thank you. Do colleagues have questions, or should we ask the partners to come up and make comments? Okay, so why don't we start with Lucille Packard, and then go to Stanford Hospital, and then Avenidas.
Sherry, do you want to sit here?
Sure. Hi, Jim.
Welcome.
Thank you. And I'm pleased to be here on behalf of Lucille Packard Children's Hospital. And we're really pleased to see this process as it's moving forward, because I think it's clear that there's some opportunities for the city in terms of moving forward on spending these community benefit dollars that can make a difference in the lives of residents who live here in Palo Alto. And as I mentioned at the last meeting, we would be delighted to partner on some of these programs, but what we really wanted to do was to provide you with what we're already doing so that you can get a sort of a sense of what's out there in the community, what's being done. Are there opportunities to leverage resources and programs? Because I think at the end of the day, we all want to do the same thing. From my perspective, I think that there are several issues that the council needs to, and this committee in particular, need to look at, which is, are we doing these as one-time only funds? Because I think if you choose to do them as one-time only funds, there are different routes that I personally would recommend going. Or you're looking at ongoing funds, whether you're doing it as an endowment or you're spreading it over 2 or 3 years. What I would tell you from experience is that it's very difficult to use the dollars for programmatic needs if it's something that's just recently been identified and think that you can fund it for a couple of years and then it'll be sustainable. That doesn't usually work with not-for-profits. It's either something they've already got going and you're adding to that, but you know where you can potentially have more bang for their buck if you're doing it as one time only for some capital needs that they don't have a way of filling, and that can then be used over a longer period of time. So I think from my perspective, that's the first decision or criteria point that this committee needs to do, is decide whether you're doing one time only or whether you want it to be longer term, and if it's longer term, whether as an endowment and using the interest, or whether you're going to split it up over a 2 or 3 year period. Because then that helps to then decide what kind of criteria you need in terms of a grant-making process. And that makes it easier for staff to understand which direction to go, because I am sure that they can give you a list of multiple things on both sides of that equation that are all good and all needed, but sort of where do you get the most bang for your buck? And I do think it's appropriate, and I know that was on your agenda, to also talk about how does this fit in with what you're doing with Project Safety Net. And again, I think I would probably take it away from the term of Project Safety Net and look at the issue of mental health issues. And looking at what's the right avenue to go. Is it having a city-run program? Is it having a school-run program? Is it having community-based programs? Is it the combination? We're well aware of all of the reasons behind when Project Safety Net was funded and started. Part of my community benefit is I actually cover the costs of the Pillars of Strength program that Dr. Shashank Joshi provides for the schools. So I'm deeply invested into that with that program. So I'm not suggesting it's not a route, but I think that's the kind of discussion you need to do, because even though $4 million or $2 million, whichever way you look at it, seems like a lot of money, it can go pretty quickly. And so again, what I look at is I have a relatively small budget. How can I leverage my resources with other community partners to make it go farther and have a bigger impact on the community? And I'm happy to answer any questions, either general or specific.
Yes, Councilmember
Let me
Schmidt.
just ask a general question. Stanford's definition of community is different than ours, I think. Our purview is Palo Alto, but it can certainly extend to neighboring, but you look at it as almost county-wide community. So what are your suggestions in the health area?
Well, we do look at a larger geographic area, but I can tell you from not only looking at our community needs assessments for the last 20 years, but looking at ones that have been done in not only in other parts of the state, but other parts in the country, the issues that Packard has identified as our top priorities are the issues that come up in every community, and those issues are here in Palo Alto as well. It's mental health, it's services for adolescents, it's obesity, it is it's asthma, it's the an increasing need in terms of prenatal care. I mean, we narrowed it down to 3, which was access to care, mental health, and obesity, because we, again, didn't think we could tackle all 8 that were identified. But I can tell you all 8 of those are in every community, and they're definitely here in Palo Alto.
Good, thank you.
Councilmember Klein?
Sherry, thank you as usual. You're insightful remarks. That really were many of the things that I had in mind, and you articulated them much better than I would.
Thank you.
Agree that one of our first tasks here is to identify whether we're using an endowment model or particular infrastructure gift of some kind or other, use the money and go out of business. So I think that was very helpful. I really appreciate you pointing out the difficulty of just supporting programs for a few years. With that in mind, all of us and our limited resources, so let's assume that you have $2 million or some fraction of $2 million. Oh, thank you. Assuming that we have, whoa. Assuming that we have that you're advising us on the $2 million or half of it. And that we're using one of 2 models, that one that we're buying some piece of equipment or helping to fund a new structure or whatever, or that we're going to set aside $500,000 as a permanent investment in a particular program so that they get $25,000 a year or so from that. Those are the facts. So what's your advice as to 1 or 2 particular things that we ought to do?
I would probably...
And then one more thing before that. The idea is, at least for me, what is it out there in those 8 questions or those 3 priorities that that Packard has that isn't being done now?
Okay. I would probably split the money into, say, for 3 years. And I would say that they should be used for one-time only funds or grants. I would make them a matching grant, because that way it gives you 3 years worth of different organizations and agencies coming forward to you with one-time only needs. It's not too cumbersome on staff in that you're not creating a permanent program, but it's something that can be modified to fit into existing staff time without too much additional burden. And I would look for, again, I would make them as matching grants. so that there's an encouragement that the organization doesn't just see this as free money, but it's a challenge to their donors. So I know that access to care is a big deal. And I would venture to say that you have quite a few seniors and others who can't get to care, whether it's the need for transportation. And so they're, you know, and my colleague Mary from Avenidas may come up, but, you know, I've had conversations as a former board member there that they're in need of a new van. So maybe you offer, you know, as part of the grant is they need to raise X amount of dollars. The city kicks in the rest. That provides access to care for seniors who otherwise were having a difficult time getting to their doctor's appointments. Makes an immediate need. Though we don't do much in terms of the adult side, I would think you've got a huge opportunity at the Opportunity Center so that there, again, can be some kind of, because again, they need some help in terms of access to care. And probably mental health issues as well. Most of the nonprofits do some, you know, have ongoing programs, so you're not starting a new program. So it's an existing program that their donors are already supporting that you can, again, whether it's helping to build or remodel a new wing or get some piece of equipment that's needed. You know, you've got Abilities United, which again is looking at doing a rebuild and their therapeutic swimming pool there that helps a whole range of patients from kids to seniors and adults and folks with special needs. So it provides an avenue. I would start looking at those kinds of things that improve the quality of life. And then we've been talking internally even what we want to do about the unmet need in terms of mental health. That's huge. And so maybe it's a challenge to the school districts to be able to actually bring mental health counselors on site as opposed to academic counselors. They're different skill sets, different needs, and not every teenager who's stressed is having a mental health issue. Some of it is normal teen angst, and sometimes we get caught up and we can't tell the difference between normal teen angst, which needs some services, and true mental health issues, which may need more intensive services. So I would look at those. What I know is, you know, we've been trying to increase our access to care for pediatric obesity. One of the things that I'm having my team work on is how can we help make more walkable communities? Again, that's something that the city can directly get involved in. You know, can we start doing human school buses and walking kids to school and then not having cars queuing up in front of schools before school and after school, dropping and picking kids up, but getting kids back in the habit. You know, I feel like my parents, my grandparents, back in the day when I went to school, but we did. We walked to school. Yes, we had school buses, but the alternative, we walked to school. Families don't feel as safe now doing that, so how do we make our community safer? That's part of community health. And there's some good programs that there's a nonprofit called Healthy Cities that works on those kinds of things. But again, it seems to me, especially in a place like Palo Alto, that prides itself on its environmental friendliness, that's something that we ought to be able to figure out a way to get kids walking to school, which starts dealing with the obesity issue, but it also starts dealing with other health care issues in it, and obviously the environment. So those are just a few off the top of my head.
Great, thank you very much.
You're welcome.
Questions?
Councilman-
He's spoken
Oh, he
already.
spoke. Oh, yeah, so I guess I actually just had one. You mentioned access to healthcare in terms of basically a new van, in terms of, you know, how does that work? Does the van take the person, drop them off, and they walk into the doctor and then waits for them and comes back when they're ready? Or is it that they walk in with them and make sure they're okay and then, you know, bring them out? I was just curious as how that works.
I'm going to defer that specifically to Mary because I picked on her in Avenidas. But what I can tell you is my dad lives in an assisted living facility, and they drop him off, make sure he gets in okay, and then find out what time to pick him up and come back and pick him up. And so he uses the van at the assisted living facility for his routine blood tests, since he is on Coumadin, so he has to have blood tests like every 2 weeks. I could use them to drive him to other appointments, but I choose to do that because I want to go in and see what his doctors are saying. But they do go in and make sure that you're there in the right place, in at least at the assisted living facilities.
And to summarize, you break it up into three.
I break it up into,
groups.
yeah.
Do a matching grant
Mhm.
for each of those three groups. But then would you break that further? You mentioned a number of things that you thought it could be used on.
Oh,
But would you actually be specific, or would you leave it up to the organization and say, get matching grants for what you think are your highest priorities? Or would you say, no, these are what we think are the highest priorities?
a combination. I would say we have a pool of $700,000 that we're going to distribute this year, and we're going to distribute it in a matching grant format. Please submit to us a proposal no more than 2 or 3 pages on what your highest, best use, what you would go after, and how much you would request for that. And you'll find some will be as small as 10, 15,000, and you'll find some that'll be as large as 100, 150,000. So and then you'll be able to make a judgment. Do we want to fund 3 or 4 at 150 or 200,000, or do we want to fund 30 of them at 25,000? And it's probably a combination. It's really looking at the agency and what the ask is. Is it something you think is fungible from another source, or is it something that they've been trying to do and it's hard? There are times when it's very hard to raise capital dollars. There are other times when it's less so.
So that was one model you suggested. The other model, if I heard you correctly, was that we should say what capital needs are needed, and then take that $2 or $4 million and say, how do we spend that for a lasting capital need that otherwise would not be met? Is that correct?
That's correct.
Would you do that on a matching basis too? Or would you
Probably. I'm really big on matching grants because I think it provides some leverage. It encourages for nonprofits. That's something that they can sell to their donors, that there's a match out there that the city is willing to match. And so, your $10 contribution is worth $20. And those are done for all different levels, and it actually does make a difference. I mean, we have a organization that matches our employee giving campaign to the hospital. And in addition, for every employee that donates, they provide a book for our hospital school. So there are you can then pair that up with other donors who are willing to do something and really leverage the city's dollars.
And then on the capital side, would you also then ask people to step forward and say what capital things they would need?
Oh yeah, and I'd have them be very specific and give you timelines in terms of how much they need to raise, when they'll do it, and I have measurements and metrics for everything that I would expect to report back. I do that for the grants we give. That says this is what you said you were going to do. Have you done it?
And then one last question on the capital side. So there's a difference between building a building and buying a van. It's an appreciating asset that doesn't last very long, and the other one is, a long-term positive, I guess. And that means not that the van's not really important. So would you limit it? Would you limit it and say it's got to be, a 30-year life, or would you say we'd do 5-year life or 7-year life? I mean, I'm thinking of a van basically as a 5-year life type thing. And maybe a nonprofit, it lasts longer than that. Maybe it's a 10-year life. I don't know.
Right.
30-year life for the van. Okay.
You'd be surprised how long we make those things last. I have mixed feeling because I think there's need in both places, and for someone who's trying to add space, that building may be the top priority. But for a smaller organization where they're maybe doing a smaller project, or they need some capital equipment, whether it may be that they need computers and things to be able to run their programs, the shorter time period, but that's probably not as sexy an ask, and there may not be other places where they have a chance to get those kind of dollars. So I think what I would look at as part of that criteria is what can the city do where others are not necessarily willing to do it, seeing the city as the safety net for a lot of these agencies, that, you know, if they had this is all that they can do. And sometimes they don't need a whole lot to be able to do a whole bunch more, but they can't quite get that piece of it. So it's hard to say I would do one or the other. I think there's a way to be able to do a little bit of both, again, without it becoming too onerous on staff. As a former staffer, I always try to make things not onerous on staff.
And often, there's grants that just by virtue of being in Palo Alto, agencies aren't qualified for because of the socioeconomics of the city. So that's when a city grant could be really impactful.
Absolutely. I mean, I think that's a really good point. We all know that there's areas of need in Palo Alto, but if you look at it on a citywide basis, not gonna make any of those bottom lines.
Well, thank you.
Thank you.
Thank you. I always learn a tremendous amount, and I appreciate your insight and great experience. I think I look at this as both, you know, there may be some limited program issues and looking at the capital side, and I think there's some merit in considering looking at both. I think the disadvantage we have here, sitting here, is that we don't have a good sense of the order of magnitude of the needs and how far could anywhere from, you know, 1 million to 4 million or 1 million to 2 million go in terms of making it impactful and making it meaningful. I think the issue of criteria is very important, but I would assume that in the staff report and in our discussions, there will be experts reviewing these applications and being able to make informed recommendations, because it's the people on the street who really understand what services are needed and what would be impactful. I think where our challenge is trying to get, you know, those pieces together and then have this a meaningful effort. And I think that that's very important. The other thing I think we need to clarify is, do we set, based on all the needs assessment information, do we set priority areas, or do we ask the applicants to justify their ask per their own strategic plan and make a convincing argument for how this is best used? So I think we have to decide how much we want to shape the criteria and what are the focus areas, also based on input from the experts. Because I know for sure we're not service providers. You know, we're not in the city of San Jose, for example. And it's that delicate balance.
It's a delicate balance, but my recommendation would be for the city to narrow it down to no more than 5 and probably between 3 and 5 priorities, and then encourage the not-for-profits to qualify within those areas. Because again, I think you want to be able at the end of the day to see the benefit of the dollars that you've invested back in the community. And if you leave it wide open and say, okay, here's, you know, 16 or 20 needs that have been, and you justify it, you're going to have it really scattered. And I look at things like you've got an incredible community recreation and parks program, you know, your swim program and those community programs. There are some things that again, help to alleviate some of these issues. You know, do we need to get more kids out playing soccer, going to dance classes at a reasonable price, especially if you're low income, that where you may not be able to afford private dance lessons.
Right.
But the city through some of their program. But you also don't want all the dollars going to the city, because then it looks like the city is just, but there's some opportunities to leverage those resources to be able to provide some opportunities.
Yeah, no, I agree with you, and I think I'm sure we can do this.
Oh, I have no doubt.
Right, so.
I have no doubt.
Thank you.
Thank you very much.
Okay, so, let's see, our next partner, I guess Stanford Hospital.
So I'm Andy Coe, Chief Government and Community Relations Officer for Stanford Healthcare now. We've changed our name. It's all right, just in the last month. I really appreciate Sherry's comments. She and Packard have been doing this for a long time, have a wealth of experience, and we ourselves have learned a lot from them. We, like Packard and other not-for-profit hospitals in California, are driven to invest in what we call community benefit activities by a California state law, and now that's been augmented by federal Affordable Care Act legislation, where we are required to maintain our tax-exempt status to invest in programs outside of our four walls that improve the overall health status of the communities that we serve. So that kind of is the overall premise that drives our activities in the community. Plus, it's, we want to be good corporate citizens. It is part of our mission. In that regard, just apropos to what Minka said, we do participate, as Packard does, in community needs assessment. These are community needs assessments that are performed every 3 years by law. They are needs assessments that we do not undertake ourselves, but in collaboration with other providers and with county staff, both in San Mateo and Santa Clara County. And that, again, apropos to an earlier comment, our service area is San Mateo and Santa Clara County. So we look at the overall trends and needs assessments from those two county perspectives. And then from there, we make our own decisions in terms of how we want to invest. We have a relatively small pot of money that we invest, about $400,000 each year that we have at our discretion. We also coordinate and serve as liaison between other hospital programs within the hospital that are already active in the community and try and nudge them to fit our community priorities that we've identified in the needs assessment. Sherry mentioned the needs that are out there. They are the same needs that have been out there for quite a while. Both the two needs assessments that I've been involved with since I've been at Stanford Healthcare. The needs are basically the same ones that have been identified over the course of the last 6 years. The key is obviously to match up what you feel are the resources and expertise that you have to really make a difference to meet a particular need. Childhood obesity, mental health services, those are not Stanford Hospital's issues. We are an adult hospital. Childhood obesity is obviously an issue that a Packard hospital has done well and should be addressing. It's not an issue that we don't necessarily have expertise in. Same thing with mental health. Tremendous issue out there, but we don't have any particular expertise. We do have a lot of expertise in aging adult services and issues involving the aging, and so that's where we invest many of our community benefit resources. One final comment just in terms of Palo Alto, again, because our service area encompasses both counties, San Mateo and Santa Clara County, and because of the socioeconomic status really and standing that Palo Alto has, we do not invest much in terms of programs that directly serve people in Palo Alto. We do provide $70,000 a year in grant funding for program capacity to the Mayview Clinic, which serves low-income and underserved residents of Palo Alto and Mountain View. We have contributed in the past to Avenidas, and I know some of our programs, Strong for Life and other programs for seniors, do operate programs out of Avenidas. And then just this year, we have contributed $25,000 to, and I just found this out, the Peninsula Healthcare Connection. Eileen Richardson's the executive director of that program, serving the homeless and low-income people based here in Palo Alto. So that's just a brief overview of kind of what we do. Again, we've learned a lot from what the Packards of the world and the Avenidas of the world have done, and be glad to serve as any kind of resource that we can, going forward for you folks.
A question. Thank you for your commitment to this work and what Stanford Healthcare is doing. Question on the Opportunity Center. To what degree, if any, are you involved with the program side? There is this very tiny clinic there, and I didn't know if what...
We have in the past, we're not currently now.
McLean?
Well, I assume you heard the question I put to Sherry, so it's the same question. Well, what 3 areas that you feel are not presently being funded that we might fund, that either ongoing projects or capital items?
Well, I'll put my hat on as a Palo Alto, now Mountain View resident, but longtime Palo Alto resident. I think the mental health side of thank you, Gail. Appreciate that, Councilmember Price. Same issues are in both communities. You know, it's really amazing. I think the mental health issues are huge. You know, for
Define further what you mean by mental health.
I think some of the issues that are affecting young people, the Project Safety Net issues that have been, you know, the issues that Project Safety Net has been trying to address. That's just my own, you know, kind of personal observation here for Palo Alto. I was talking to our community benefit person today, and she was saying the same thing, just in terms of, I mean, this is the larger issue all over, countywide and throughout the country, if you want to really take it big time. And we're struggling with it at the hospital level. How can we improve overall mental health services and work better in collaboration with county providers?
You're focusing on adolescents, though?
We're not, no.
No, I know that so.
Oh, in my own personal opinion?
What is Stanford Hospital?
We're not, that's what I said earlier, we're not particular experts on mental health at this point. So we're not really focusing in terms of community investments on that particular issue. We're trying to get more up to speed internally, working with the county so that we can provide better care for mental health patients that come through our doors.
Okay, let me follow up on that. Say mental health. Well, what do we do?
I'm not really an expert, Councilmember Klein, to answer that question. It's just more my observational kinds of take on things.
The areas where the Stanford Hospital does have expertise that you think there's some gap which is not presently being funded.
Well, again, I think the needs that have come through in terms of community needs assessments that Sherry referred to and that we've participated in too in terms of the counties, those are issues that affect communities like Palo Alto. And again, I don't have any, magic insight in terms of a specific issue. Again, we try and match up what kind of we do best with our limited resources, and how can we make the greatest impact possible with those limited resources. It's not necessarily a simple process, for a community like yourselves, and I fully appreciate the position you're in terms of trying to figure out how to maximize the use of the resources you have.
I do. So, Andy, I guess the question I just try to follow up on Councilmember Klein said is Sherry indicated breaking it up into 3 parts. One of those parts, I guess, would be programs that you might be interested in running. I didn't hear any needs from you guys that you might want that you might be interested in.
Well, again, I'd go
I heard
back.
you talking about adolescence, which is Sherry's part.
No, I understand. And I was putting him on my personal hat, in terms of
That's
looking
good.
at Palo Alto issues and
Breaking
asking
it
about Palo
into
Alto.
2
Yeah.
might be just fine.
Well, I mean, in terms of Stanford Healthcare and what we're focusing on, we focus on access to care programs for seniors, and then, reducing health disparities, particularly in the field of cancer care. And so those are the areas we happen to think that those are, again, identified community needs that come through the community needs
So the
assessment.
community needs in Palo Alto, or are they countywide? Because I know
These are county, and that's the important point. This is data collected from both San Mateo and Santa Clara County. I can't parse out
So that's what I was going to
necessarily.
ask. Could you parse out and say, of any of those things that you focus on, do you see a community need in Palo Alto, or is that just too difficult?
I couldn't parse it out that specific. Yeah.
I'm good.
Yeah, just along the same line. I note in your prioritization, you've done a very good survey, but it's countywide, both San Mateo, Santa Clara. You then compare it to California. And you have good data about average scores, disparities, prevention opportunities, community priority scores. But I look at the demographics, certainly against California. We're not like the California numbers, but Palo Alto is actually not like either the Santa Clara or San Mateo numbers. So how do we get priority needs for our community?
Well, maybe you focus further down and focus particularly on Palo Alto and do some kind of parsing out of either data, focus groups, that kind of a thing to really focus on, take advantage of people, organizations like Avenidas that are working in the community and consult more specifically with them.
Yeah, I know in your surveys and your focus groups.
And these are the countywide that we work on with other folks,
there's pages of people
Right.
you have.
Yeah.
But the people you're talking with are primarily county people, or who have county agencies, or health departments.
Mhm.
Is that right?
As part of the focus group and information gathering
Yeah.
process.
So
And
I
that's,
guess
again, we hired consultants, both collaborative, San Mateo and Santa Clara County have hired consultants to
Yeah.
perform these research and
Cities
assessments.
do not have prime responsibility for health, which is why you find the health people at the county-wide basis. So it may be that our looking at needs would come up with quite a different answer. Maybe they go beyond the bounds of the traditional healthcare providers. As you say, maybe it's mental health and counseling, or opportunity
Mhm.
centers, or homeless groups, or something like that,
Mhm.
that don't fit in the normal category of needs that appear here.
I mean, that could very well be. My guess is that, within the 10 or 11 issues that are out there that come up in these county collaboratives, that you're going to find them, as Sherry was indicating, you're going to find them here in Palo Alto as well. But
Yeah.
that's just my own personal opinion. There's no particular data,
Yeah.
based on that.
It seems to me one of the things we could do with the healthcare system is not try and resolve any of the problems, but get people into those organizations that are effective in dealing with it. So maybe enrollment grant
Mhm.
might be one of the most effective things we can do. Does that make sense to you?
That could make good sense. Yeah, we've always tried to, again, put our money into programs that actually provide services for people, and access to care. Enrollment certainly would be a component of that.
Yeah,
to bring,
so if we could get people into those programs,
right.
might be a
Yeah.
real benefit.
Mm-hmm, mm-hmm.
Good, thank you.
Thank you. Just a couple quick comments on the mental health issue. One of the things that Mr. Coe was mentioning is the fact is there is a lack of hospital capacity for emergency psychiatric hospitalization, and that is true not only at Stanford but throughout the county. And of course, those kinds of services, and in order to qualify to provide those services, are extraordinarily expensive. And certainly this money will not be an answer to that, but it does underscore the need in terms of collaboration and looking at other opportunities. Hospital diversion programs, for example, but then you divert someone to what? There's not enough capacity to engage in crisis intervention and stabilization. So this is something that affects all ages, and in the Project Safety Net, we have sort of one lens, but this is something that affects people of a wide, range of experiences and ages. So thank you for your comments, and this is very helpful.
Okay, and again, as Sherry said, we're more than pleased to participate with you if there's anything that we can provide in terms of resource, thoughts, expertise, whatever. Don't hesitate to call on us, and there may be others within our respective organizations that, if you wanted to consult with them, we'd be glad to make them available to you. Okay, thanks.
Thank you. Okay, now, Avenidas.
Is it okay if we both come up?
Sure. Welcome, we're delighted you're here.
Thank you so much.
And we're delighted our other partners are here too. Okay.
Great. Yeah, so
Day 7. Day 7. So this is really learning by fire here. So, but yes, I'm Amy Andoni, and I'm the new president and CEO of Avenidas, and very excited to be here. I don't know if you guys want a little bit about my background, or if you probably have seen the.
What do you think would help us the most?
This really excites me. I can say I've been really involved with community advocacy for a long time. I've served on the Aging Services Collaborative of Santa Clara County for the past almost 8 years now, and have done a lot of advocacy work around senior services in Santa Clara County. So I am relatively new to Palo Alto. I did go to Stanford a decade ago, but I'm very happy to be back in this community. Truly an innovative, great community to be working in, and very progressive as well. So I think that my passion for the advocacy around senior services and working with the city of Palo Alto will be a great part of my new job. So thankful for this opportunity. So I've spent the last 7 days trying to really get to know the different programs and services of Avenidas, and just have been very just impressed and awed by the scope of everything that Avenidas does. So I have Mary here to correct me if I misspeak about any of our programs and services, but as Minka had explained earlier, the true focus of all of our programs and services are threefold. We have a focus on healthy aging, focus on access to healthcare, and then a focus on social engagement. And all of our programs fall into one or multiple of those categories. So we've had some staff discussions in the last couple of days around this potential funding opportunity, and we had some of the same questions that Sherry and others had of, is this one-time only funding? Is it ongoing funding? And that truly changes what we come forward and propose to you in terms of a project or a program idea. And we kind of had the chance to look at, 3 different angles. Our first thought was, this would be great if we could subsidize some of our general operating expenses. Not very attractive, obviously, to a city, but, we truly do subsidize so many of our services for the seniors served by Avenidas, and, finding that general operating support is always a challenge, and, we're always looking for those types of funding opportunities. They're just not as exciting, but, really trying to just support the great services and programs that we're already doing, and to make sure that we're able to continue serving not only the existing clients, but other clients in need of those services. And then we looked at it through the angle of one-time only funding, and all nonprofits have a wish list, and there are things that we just put off purchasing, whether it's that van that we've been needing so desperately for the last couple of years, or the van that we are pretty sure will have to be put to rest in another year. So, it's like, how many of those vans do you need? Looking at our infrastructure in terms of our computers, and, when are we going to upgrade to Microsoft 7, and, things that we make do with because we simply have learned to be thrifty and to make our dollars go the mile. And then the category or the angle that I am most attracted to is that big new idea or concept of what needs are out there that we are currently not even beginning to address or to meet. And what is that shiny penny or that shiny concept that we can bring forward to you and say, we have the ability through these funds to take things to a new level. And, for example, we've been talking for years about having a fitness center for older adults 60 plus, and it's something that we've just never been able to do because we haven't had the funding and the opportunity. And there's just a million other ideas that the Avenidas staff and participants have brought to us that, we have kind of on a big wish list or a big idea list that, at some point we'll get around to implementing, but we need that funding. So I don't know until we know more about the criteria of what you're looking for and your priorities. If I think we could find opportunities in each of those categories, and it really will depend on what the city is looking for and getting back to those priorities. But I think there are definitely unmet needs in the community that, we're either just beginning to address or need to be, we're not even doing it yet and we need to address it. But, we'd also talked a little bit today, about the need for maybe another community needs assessment for older adults. We've been doing kind of internal polling of our clients over the last couple of years, but there really, to my knowledge, hasn't been anything kind of citywide for quite some time. And, maybe this is an opportunity to kind of do a more thorough community needs assessment before we decide what these priorities are going to be. So, so we are open to partnerships and collaboration and working with both the city and other community partners to make these dollars go the mile if we can. So And Mary, I don't know if you want to say anything else?
Yes, I'm sorry. Mary, how you ring the last dollar out of all the rest of I do. And some of you look very familiar around this table. Thank you very much for the opportunity to address these needs. My name's Mary Hohense, and I'm Vice President of Development for Avenidas. And we do raise a lot of our budget from our community, and we take that very seriously, as well as our partnerships with the City of Palo Alto. Amy's hit on several things that ring really true to all of us. And the one thing that I'm reminded of every day as I look around this community is it is aging. And it's not because I work at Avenidas that I think that. I know that's easy to fall, like you think everybody's sick or something, but it is very, very true. Yes, they're sick of aging. So if you look at the demographic breakdown, we are an aging community. And the city of Palo Alto and surrounding areas. That is something that we all have in common, hopefully. And it is the thing that can put some of the harshest pulling on our community resources if it's not addressed properly. The issue of keeping older Palo Altoans healthy out of the hospital, we all care about that. You know the statistics about how healthcare, as we get older, we take more of that resource. That is a huge drain on a community. The idea of having to start supplemental services for seniors where things weren't met ahead of time. One of the things that Avenidas, the backbone of the people that started Avenidas 44 plus years, is they wanted to help people as they age be in charge of their own lives. And I think that rings true with all of us today and at any age, helping people be the best they can be. And the area of fitness and health, you know, we're not talking about a fitness center so that an 82-year-old will look good in a leotard. We're talking about a fitness center where the woman who's had a stroke can now get herself dressed after doing Strong for Life exercises and other supportive service. We're talking about Pilates that help older adults not fall at home so they can stay in their home and that they're not running to the doctor. We're talking about transportation services so they get to the doctor for that preventive visit or that visit when something early on is happening. It's not, I think all of us have said, we can't isolate things of the services we provide or our community needs. Community needs are a network, and that is, you know, that's an obvious thing to all of us. So I think capital needs would always be attractive to Avenidas. You know that we are working, beginning planning for a new expansion on our building, and space. The reason we haven't expanded a lot of our programs to meet the wave of the aging in this community is because space is an issue for us, a very real issue. But there's also the issue of simple things like transportation and our door-to-door program and getting people to the doctor and getting them to the lunch with their friends so they don't feel so isolated. All the things all of us do every day is about a lot of little things that come up to be big community impacts. So I know you have a very tough job ahead of you. I always said I wanted to give away money, but I think in some ways that's one of the hardest jobs because you have a great responsibility. So we would be happy to entertain, along with everyone else, looking at things in different ways and talking about different collaborations.
Colleagues, questions? Councilmember Clark?
Amy, we met briefly with your introduction. Yeah. As a former chair of the Avenidas board, let me ask you the tough question of, you said, depending on the criteria that the city sets up, and I want to turn that question around to you.
Yeah.
And say, you're advising us, and what do you think those criteria should be? Should we be emphasizing infrastructure projects, supportive ongoing programs, anything else? So you're the guru now, and, so tell us what you think the criteria ought to be.
Yeah, I loved the idea of the match. I really think that we'll go the mile with donors and leveraging our relationships with donors. I mean, capital needs are our big focus right now for obvious reasons. We, in order to continue to grow and to serve more Palo Alto seniors, we have to figure out our space issues. And there's other infrastructure issues as well around, transportation and internal technology, but space is our biggest issue right now, and we need to go out and up and out into the community as well, and begin to kind of look for new ways to grow. So yeah, capital campaign needs, infrastructure needs. So technically those I would assume are one-time only funds. But.
I want you to take it this beyond Avenidas. There are other senior serving organizations
Yeah.
Who do good work as well. Do you think that would be true for them as well as for Avenidas?
I can't speak for them. I think, like I said earlier, I think we all have wish lists of if we just had a little extra money, like we could do this or bring this, to our organization. So what that thing is, what that wish list is, will differ, per organization. I question whether you need to just restrict it to one time only versus, opening it up to, let the organizations come to you and say this is what we have, whether it's a new program idea, whether it's a general operating expense that they just need some additional support with during this time, or one time only. It makes it harder to kind of evaluate when you have apples and oranges and one person asking for one time only and one person asking for help, or funding to start a new program. But I think each organization is just so different that they have to truly speak to what their needs are as an organization and to how they're trying to address the identified needs of the community. So I went through a similar process about a year ago at the County of Santa Clara, and there was this Measure A tax funding that they had that became available, and it was about $4.9 million. And they had to figure out how they were going to spend this funding. So they opened it up to the community. They said, tell us what the community needs are. They didn't limit it to senior services. They didn't limit it to housing services or youth and family services. They said, come to us with your ideas, your concepts, your proposals. You tell us. You were on the ground in the trenches every day working with clients of all different demographics and backgrounds. And they ended up receiving 97 proposals, which was a little overwhelming. And they had staff that had to come up with a way to kind of evaluate each proposal, even though they are all different. Some were looking for one-time only funds. Some were looking for, they were trying to implement something just totally new and innovative and creative. And they ended up funding a mix of those different proposals. Not all of them, not all 97, but they narrowed it down to 17 that they felt had value and would add value to the community and serve more people in need. So I thought that was a kind of innovative approach. And, there were complications to it, but, it was different than trying to put everybody in one category and limiting the funding, because I think organizations have the capacity to make the dollar go the mile in different ways. So.
Well, that's very interesting. That's something that I was aware of. Maybe we can get their procedures that they use.
Yeah.
This is at the county, so it's one of the county programs.
Yeah.
Out of which department, or?
It was the Board of Supervisors oversaw it, but really.
The money late spring.
Yeah. And we.
Decision-making process, do you know? Who made the decisions?
Who made the decisions? It ultimately was the Board of Supervisors with staff counsel. So they hired staff that kind of helped evaluate the proposals based on the criteria that they came up with, and then they weighted each proposal, according to those criteria. So it was a very kind of scientific, numerical process, and
You don't know which department it went through?
It was. I'm not gonna. Don't quote me on this. It was Family and Senior Services, I believe. Chavez, yeah, Supervisor Chavez. So took a longer time than I think some folks would have wanted, but I think the ultimate outcome was just great. I mean, in terms of there was a diversity of funding. It wasn't just all seniors or one population group. So and folks were relatively happy with the process when it concluded. So. and we based it all. So I was wearing my Aging Services Collaborative hat, and we looked at the seniors agenda and what the needs were identified for seniors in the county, and we chose to focus on case management and transportation, and those were the two proposals that ended up getting the funding for senior services. So something maybe to look at in terms of a different type of funding.
The supervisors really get involved in the process?
They did, yeah. We had meetings with their staff people. They were really into the process. And what came out of it was some general operating funding for, city or county programs and community programs. Some new ideas. The case management program that got funded for senior services is totally new, and now DOS is turning around to implement it in contracting with a community-based provider. And then there was some one-time only funding, a new computer system for a nonprofit that just couldn't, come up with the money on their own to fund it. So, yeah.
I think one of your safeguards, I also really like the idea of matching grants, because if people cannot, if they don't have the bandwidth to raise extra money, let's say they're even you're doing some smaller grants, $5,000, if they can't make the case of support to the community at large, then how can they make the case of support to the city in public dollars? So I think, and that isn't a sophistication thing. It's actually a quite easy thing to do with your support, and it doesn't mean that you would have to restrict it only to individual donors, individual gifts. You could expose it to, if you get a matching grant from another foundation, which many of them are happy to do. The other thing I would encourage you to do is there are so many fabulous foundations within this community that fund things all over the world. Engage them in a dialogue. Use their talent. Use their, they wouldn't necessarily be at the table getting the money. Use them as that objective, to say, what should we be looking at? What are some of the things? We don't have to reinvent the wheel. Sometimes I'm perhaps very lazy, and I would rather somebody else have figured out all the problems first. But you have some wonderful talent, and it'd be a nice way to engage that group of people, too.
I'm going to have trouble with this until the second week of January. Councilman Shaw.
So welcome. Congratulations on your new job.
Thank you.
I was sort of excited by the fact that you're embarking on, Avenidas is embarking on this big new expansion, right? I mean, you're out raising money, you have new plans and all of that. And I think this is an opportunity we can use to be successful on this. And so I was really interested in hearing how we could use some of these funds to make that a reality and, on a matching basis, kickstart some of it. Because that to me seems to be a lasting benefit to the community that, as you said, space is your biggest issue. And I want you to be successful at this. And you're going forward, and Junior Museum Zoo is going forward at the same time, and everyone's out raising money. So I guess if you could address that.
Yeah, there are definitely opportunities to help in the design of that new space. I mean, we are fundraising to build the building and get the building off the ground, but and Lisa Hendrickson is the campaign manager and will be overseeing that that fundraising. But it's also now a conversation between Lisa and me and the staff of what goes inside of that new building and what do we bring into it in terms of new programs and services and what does it look like. And staff already have so many great ideas for how to take what we're already doing to the next level inside the new space. And we were talking today of, one of the biggest complaints so far about the new design or the drawings that we have is that it takes away all of our outdoor space. We have this gorgeous little courtyard, and participants are really upset already before this building's even built that we're doing away with that. So we have one staff member who was like, I have this vision of a rooftop garden, and how do we make that happen? And thought it was a great idea. And then we have this concept of the lab that we're working on, of partnering with organizations like Aging 2.0 and IDEO and Stanford Design School. And how do we start to make aging more attractive to the designers and the entrepreneurs out there who are coming up with solutions for aging in place? And yeah. It's better than the alternative. So, but there's some, what we found is that there's these startup, ventures out there that are designing technologies and products for the elderly without fully beta testing them. So they think there's this perceived need that, a senior needs this new gadget to do this. And then they go out and spend billions of dollars or thousands of dollars to design this new technology and find that it's really not what the seniors want. They don't want a new iPad device or app. They truly need something different. And so bringing the fields of technology and design and engineering kind of into the folds of Avenidas and having there be kind of this dedicated space where seniors and designers and entrepreneurs can work together to truly come up with solutions that will help the entire community, but particularly older adults as they continue to strive to aim in place, and then to support their family caregivers as well. So that's a concept that we will be working on and hoping to implement in the new building, and then also looking at putting our what can I say, money where our mouth is, but so we're going to design this beautiful new building, very modern, and it'll be a hallmark, hopefully, of the community. But how do we take that design inward as well, and kind of looking at how do we design a really truly age-friendly environment inside for seniors? So again, all stuff that we're not necessarily trying to raise money for through the capital campaign, but looking at down the road, how do we start to fund some of these new innovative ideas as well? So those are just a couple of ideas. The fitness center, we're still trying to figure out if that's something we could bring in-house in the new facility or not, but
So you said would it also be the kind of fitness center where if you're older, you would just go work out like the Y, the Y, a lot of older adults were working at the Y, and that's closing up.
Yeah.
So I was wondering if that would be something that, if we helped fund that, whether or not that fills a community need that I knew existed, and whether or not that brings more people into Avenidas.
Possibly,
a gym tends to do that. It tends to become
the community.
I see that.
Yeah.
Their gym is what drives huge numbers of people over there.
Yeah.
And then they do all the other programs as well because they're over there.
Yeah.
I was wondering if that was something that.
At this point, yes, we are talking exercise, mobility center, fitness, for lack of a better word, center. But it is not, at this point, a lot of the drawings and so forth, what we don't want to get caught in is that making something that is available elsewhere in the community. We want to be careful about not duplicating things. And so this fitness center would have special flooring, so older knees, and joints can exercise easily. Some equipment, but I'll be there with you, Larry.
He's going to be my caregiver.
And appropriate kinds of, bars, grab bars, and things to do exercises. People really talk a lot about the fitness, but the fitness is fitness for life, and being able to be healthier and more engaged in your life because you feel better, and because you feel better, you have a better attitude. I mean, you all know all the data about how exercise helps your brain, helps your whole body. So we're trying to make this that we're not just taking somebody else's gym someplace and plunking it here. And in fact, a lot of the drawings don't have much equipment in it at all. We're very much class, hands-on kind of with our fitness. It's about a really well-versed instructor in senior exercise working with people. That's why people come to Avenidas. There's a zillion gyms sitting around that are empty. They're coming there because they get the kind of things they need, and they're meant to feel part of something really great. And it's okay to be old at Avenidas, or older, I should say.
We have had a lot of participants come to us who are very upset about the YMCA closing and saying, why couldn't Avenidas just go take it over? So maybe in the future we do look at a fitness center for more active seniors, you know,
So I have one other quick question that just probably shows my ignorance.
Mhm.
We talked a lot about a van, and my confusion on this was, wouldn't it just be cheaper to have people take Uber and pay for it?
So there is actually a startup out there called Lyft Heroes that is taking the Uber model and transforming senior transportation. So they're actually using retired EMT drivers, ambulance drivers, and having them be available with their vehicles to do medical transportation. And so it's called Lyft Heroes. It's a startup that Aging 2.0 is working with. It's a very interesting concept. So there is definitely innovation in that area as well. And we talked about, like, do we ask you guys to help us purchase a new bus? Well, there are other funding opportunities out there that we could pursue if that's really what we wanted to do. But I think the general consensus is that we wanted to do something different and better than just purchasing a bus. But, you know, especially around all this focus with the capital campaign. So,
Well, thank you.
thank you.
Thank you very much. And a quick comment about the program side is that I think your points are very well made about the program money, meaning that that has, the issue is sustainability. I mean, you can get support, and then if you don't have a plan to sustain it, then, you're now not providing a service which then people had originally expected. So we get into all of that. But your insight and comments, very good. Thank you. Okay. Should we move ahead to the second item, or do we want to talk about this at this moment? Or just move ahead, just as part of our information? Move ahead? Because there are a lot of people here who want to speak on the second item. Health and Safety Funds, this is Stanford Development Agreement related to youth well-being and Project Safety Net.
We just need a second.
Okay, and also I have 4 individuals who want to speak to this item as well. So, once you get ready to go.
Yeah,
Okay.
it'll take a minute. I can't do the finger.
Why don't we do that so we won't waste time? Okay, I have speakers here. Carolyn Digovich, why don't you come first? Brenda Carrillo. Let's see, Judy Jaramillo Argumento, Mendo, and Susan Osman.
Good evening. I'm taller than the average bear. Thank you for giving Youth Speaks Out an opportunity to speak to the council about this program. We know that, I understand that Project Safety Net is in the process of being looked at for restructuring. And I'm here to talk about a project that that grew directly out of the 2010 Youth Forum, where a couple hundred of our kids came together, as you know, and advanced some action items that they'd like to have adults, caring adults in the community, collaborate with them on. And one was the request for a recurring arts venue where they might feel safe to create, display, and share the experience of life in Palo Alto in their body, in their special community, in their family, in their sexual orientation, in their ethnic makeup, in their socioeconomic status, etc. And I'm a former arts administrator from the state of Massachusetts. I dealt with a lot of kids in probably half the schools there back in the 1970s, a long time ago. And so I volunteered 4 years ago to work with the Palo Alto Unified School District faculty to execute that vision for and with the youth that are now graduating this year. So this was a personal promise to accompany them on this project. Deanna Messinger, who is a just phenomenal visual arts teacher at Gunn High School, she met with me over the summer of 2010-2011 school year and put together a curriculum based on the Not in Our Schools program. And that curriculum deals with creating a safe environment in an arts classroom where it's very highly structured. They have artistic. It's an artistic sensibility that is rendered in these different classrooms, from painting to drawing to photography and so forth, where students may express what's happening with them directly through the arts, and create such a safe place where students can express what's really going on with them. And then narratives are developed over time so that students get to reflect on the unfolding iconography in the artwork. What is that slashing that keeps happening in every painting over and over again? And because the work is done anonymously, of course the students all know who's in the class, but none of the work has gone viral, and some of it has been very, very edgy. It's all poignant and absolutely stunning. And I'm going to wind it up by saying that the project originated under the Youth Collaborative, and the Youth Collaborative was subsumed under the auspices of Project Safety Net. And because of being in the room with Project Safety Net, all the stakeholders, many stakeholders were identified. Palo Alto Arts Center became one of our venues because we sat in that room and discussed this. The rec department was involved. We got a little bit of funding the first year from Project Safety Net, but Project Safety Net therapists came in and at the end of the session looked at all of the artwork. And also we had an adolescent counseling services the first year, an art therapy intern come in and be a familiar face in the classroom, so that actually we've had some interventions every year. And so, yeah, that's all I have to say.
That didn't work so well. There we go. That should be fine. Good evening. My name is Brenda Carrillo, and I'm the Student Services Coordinator with Palo Alto Unified School District and also the co-chair of Project Safety Net. I want to share that the district really values the strong partnership between the city and the district. Project Safety Net is successful due to the work of the many committed individuals who give time, energy, and resources to support student health and safety. The collaborative efforts of community partners across Palo Alto have assisted the district to better serve children, youth, and families struggling with mental health issues, and also to promote youth well-being. Project Safety Net has partnered with the district to provide and support QPR training, mental health education, suicide prevention and outreach, and community events to raise awareness of mental health issues. District efforts to ensure the well-being of students are enhanced by the coordination and efforts across school, city, and community. We very much look forward to continuing to enhance these partnerships with the city. Thank you.
Good evening. My name is Judy Jaramillo Argumedo, and as a resident of Palo Alto and a district administrator for Palo Alto Unified, The emergence of Project Safety Net during a time of crisis gave me hope that the city I live and work in truly values the well-being of our youth. In the early years, Project Safety Net collaborated across agencies and was able to start a real dialogue about mental health and stigma. As a mother of 2 teen daughters, I did look to the city and the district for support in my family, and I was heartened to hear about the efforts of Project Safety Net. I officially joined PSN 2 years ago and participated in reshaping a new vision and mission as a collaborative move forward to begin new endeavors. Being able to hear multiple perspectives and co-create plans on how to support youth has been a valuable experience for me as a resident, mother, and educator. I am proud of the work the collaborative has been able to achieve and hope for further collaboration between the city and the district continue. Thank you very much for your time.
Yeah. Hi, my name is Susan Usman, and I am this year's PTA Council President, and I also have 2 teenagers in our school district. I've been involved with PTA since I moved here 8 years ago, and have been involved with Project Safety Net as an individual for the last 2 or 3 years, really mainly attending the general meetings, but as the PTA Council President has a position on the leadership team, so I was able to step up and I've become an active part of the leadership team. Earlier this year, I got to take over before I took over the presidency, which was really nice. I would like to let you know tonight, really, the ripple effects that have occurred because of Project Safety Net throughout our community. We, really, Project Safety Net has just had a huge impact, mainly through, well, from PTA's perspective, we have really grabbed onto the developmental assets and run with it, and we have active programs in almost every school, and this is all around building youth resiliency and well-being, and I feel like we are educating parents every day on how to take care of our children, and so they will grow up to be resilient and healthy adults. We also host many parent ed events also with the focus of youth mental health, and those have been very well attended, and I just want to also say that just having the collaborative meet, especially the leadership team, of course, is made up of many different organizations in our community that work together with a specific goal of increasing youth mental health. And then the larger collaborative, it's just amazing when you sit in those meetings and understand that 40 people in that room are so powerful in then taking out the message and the work to help our youth in our community. And that's what my main focus is, to let you know how powerful Project Safety Net is for our youth well-being. Thank you.
Thank you. Appreciate very much everyone's comments and your devotion to this work. Okay.
Thank you.
We have a staff report, please.
Sure. Rob DeGose and I, Assistant Director from Community Services, are here to give you an update as requested on Project Safety Net. And we do so with the grief of last week's death still with us tonight and the passion for the work that still needs to be done. We will be sharing with you tonight the history of the work so far, just a brief history, our strategic planning process, lessons learned of working on this effort for over 5 years, and opportunities for the future. And you've already met many of the members of our leadership team, and they're available to come up afterwards, especially representatives of the school district, if you would like them to join us at the table. So I'll turn it over to Rob, who will spend just a few minutes on history.
Good evening, council members. Good to see you all. Rob DeGose, Assistant Director of Community Services. And I want to thank Minka for all the work that she does with Project Safety Net and trying to hold this pretty complicated collaborative together. We'll talk a little bit later about our efforts to try and staff a position to do that has ultimately not worked very well. So we're looking at other options for the future. But Minka's carried a heavy load and I think has done a really good job. Just in terms of history, I want to say that the Palo Alto community has a long history of collaboration for youth well-being. Project Safety Net isn't the first collaborative, and it won't be the last one, and it'll look differently in the future. I think the community of Palo Alto, and you know this, and you serve the community of Palo Alto, but they care deeply about the well-being of young people. And you can go back to the Safer Summer efforts of Judy Kleinberg, former mayor and council member, the Youth Master Plan in 2003. There was a SHARE committee, a Palo Alto Drug and Alcohol committee that worked a lot with many, many partners. There was the Youth Collaborative we heard about, and there are others. And it's really because of that value of collaboration in the community that Project Safety Net was able to form in the first place. When we had that cluster of suicides that really shook the community in 2009-10, when we had five deaths in a matter of 8 months. It was very, very scary. And many people mobilized all over the community, including parent groups in the faith community and the medical community. And we called them all together and said, how can we do this more deliberately together in a more intentional way? And that's what we've been trying to do. We've had some successes in some areas where we haven't made enough progress, I would say. We started with a plan that had 22 strategies under education, prevention, and intervention. Maybe you remember that. And we accomplished a lot of those goals. And I say we, it was really partner agencies like Lucille Packard and others, actually. And now, we've gone through another strategic planning process and have a tighter, more focused strategic plan. And that's really what we're going to focus the majority of this presentation on. And Minka's going to lead that part of the discussion. So we'll begin with that.
Great. Thanks, Rob. So as Rob said, one of the key things we want to do tonight is share with you the creation of our strategic plan. So you have a good grounding of the process we went through and where we stand now as far as the path forward. We gave a similar presentation last year at the City School Liaison Committee. So we started this process in the spring of 2013 and it concluded our efforts in that fall. So why did we do it? We really felt we were at a point in our life as a collaborative where we could look back at significant accomplishments of the previous 3 years, and Rob elaborated on some of them, but we wanted to look forward and see what we wanted to focus on in the years to come. So we asked ourselves these questions. What is the philosophy that guides our program? Is it suicide prevention, youth well-being, or is it both? Are there core strategies that Project Safety Net should affirm? There was attention, and Councilmember Klein alluded to it at a previous Policy and Services Committee. There was tension that existed between some stakeholders about the focus of these core strategies and the spectrum on which our program should focus. So we really felt that was a careful noticing that we wanted to look into. We also asked, how should we be structured to support these core strategies? So we hired Compass Point, which is a nonprofit consulting firm, to lead a collaborative planning process and have these important conversations to reach towards a revised strategic plan. So we involved a lot of people, as you hear from needs assessments and strategic plans. We try to do a broad reach as much as possible. And these are the folks they're part of the working committee that helped us do so. But we had broad meetings in the community. We had a huge meeting at Lucy Stern at the very beginning that over 100 people came to. Our collaborative members, we had people who were involved from the beginning of Project Safety Net, and we purposely put people on our planning team that were never involved in Project Safety Net in the past, so didn't have a history of what went well or what went wrong, or were able to say, I've never heard of you, why? And we felt that was valuable input to have. We had focus groups of parents and youth leaders and youth themselves and faith leaders. The working group is shown here, and we use the services of our initial Project Safety Net leadership team. These last two groups were the main groups that did the synthesizing of the information that we received and planned the strategic plan. So where did we end up? And I'll ask Rob to move forward. So this is a visual of our strategic plan. It was also included in the staff report. And let me walk you through the 4 elements. So first, you will see on the left values and guiding principles. If you can go back once, Rob. Thank you. So this was a very rich conversation. When you work as a collaborative, you need to have a shared understanding of the spirit in which you want to do the work. I'm not going to read it to you. As I mentioned, this was in your staff report. But we pledged to work together in collaboration, in hope, with courage. This is not easy work to do. With integrity, with cultural awareness and engagement, and learning. We needed to be humble. We needed to know that there were things that we had expertise on, but there were things that we still needed to learn, and we didn't have all the answers. So from all that working together, we worked next to the problem statement. And this was from countless hours of conversation and testing with members of the collaborative that we did come to this problem statement. And I'll read it to you because it's a little bigger than it was on the previous one, but I'll still read it to you. So the Palo Alto community struggles with the pain and loss of youth to suicide. There's urgency for ongoing coordinated community action to promote youth well-being and suicide prevention. And you know, in the end, there was a real sense that all youth need support to grow up in a community where they feel valued, cared, and listened for. And that's our job as a community, we felt. And that's where working towards youth well-being comes in. But however, there will always be youth who need mental health services and more specialized and focused care and attention. And that's also our job as a community. And that's where suicide prevention comes in. We think both are important. We feel it's a continuum. We often refer to this as working upstream, which is youth well-being and developmental assets, and downstream, which is mental health support and suicide prevention. So strategies. So how are we going to do this work that we feel is so important? And I'll draw your attention again to the visuals. And you'll see that the strategies cross the spectrum. They're from developmental assets to creating and nurturing meaningful connections between youth and caring adults, to educating and training youth and adults in the signs and risk factors of suicide. We want to create a community-wide understanding of mental health issues, and stigma reduction is really key, and it infuses itself in all the work that we do. We wanted to work towards reducing access to lethal means of harm, and to increase knowledge and access to mental health services for all youth. There is a lot of work to be done. So now I'd like to move on to our anticipated changes. So how would Palo Alto look and feel as a result of our work? The visual once again lays out a series of anticipated changes, and the strategies directly morph into specific anticipated changes. And I could read them to you, but I'd kind of like to do something we did at a collaborative meeting a couple years ago, and that was ask people to dream about the kind of Palo Alto that they would like to see, and I think it really encompasses all of our anticipated changes. So this is a hypothetical conversation that a teen would have with us about growing up in Palo Alto. I would like that teen to say, you know what, growing up in Palo Alto, I felt cared and valued for by my friends, parents, and the community, and my teachers. If I needed someone to talk to, I knew that someone beyond my friends, that there were caring adults that really listened to me. If my friends and I were struggling with something more serious, we knew where to go for help from professionals. Asking for help was a sign of strength. It was a great place to grow up. And for us as members of the PSN Collaborative, that would really be a mark of true success if we could have our youth feel that heard and valued and supported. You're on.
I'm on, okay. So a question that comes up is then, so who does the work of Project Safety Net? And sometimes people don't quite understand it, and let me try and explain it a little bit here. The entity itself doesn't do the work. It's the partner organizations that make up Project Safety Net do the work, and there's been as many as 30. I think now we have 26 organizations or something doing the work, and the idea is that not any one organization can hold the work of youth well-being and suicide prevention. It's something that Vic Ojakian, who's sort of one of the founders and is still an advisor, a very important one in this work, said really early on during the time we were developing this was you have to be pervasive in the work. It has to cross the boundaries of family and school and the community in the city. It really has to be everywhere in a systematic way to really have an impact. And so we use this social ecological model as an example to think about our work, that it doesn't lie in just any one place. It lies across all of these different areas. And these aren't all the partners, but it's sort of a visual example of where the work is, crossing all of those boundaries. We sort of, in some ways, I like to say, I said the other day, we're making a bet that if we bring these partners together that all care about the same thing, we know we have this common interest and common agenda for youth well-being and suicide prevention. If we bring them together and we learn together and we challenge one another when appropriate, we go back and we do better work in our organization. We run a better Office of Human Services, which Minka runs. We run a better Mitchell Park Community Center that serves youth because I have a relationship with Becky Beacom at the Palo Alto Medical Foundation and Linda Lenoir, the district nurse, or Brenda and others. I know the executive director of the YMCA because we've built this relationship as being part of this common collaborative work. So the idea really is our partner organization is doing the lion's share of the work. There are Project Safety Net working committees. There's 3 of them. One focuses on community engagement, one on community education, and one on mental health. And really it's our mental health partners that are working on that. And so they're certainly doing collaborative work together. But really the heavy lifting is the partners in their area of expertise. And then leadership.
Right, so this is just a visual of our current leadership team, many of them who are here with us tonight, and this is the new team that came on after the new strategic plan, and it is a nice combination of people that were involved since the beginning and some new voices on the committee that, just like when we created the strategic plan, having new voices on the leadership team has really pushed us forward in new ways that I think has been important. So I'd like to move on to the next slide, the lessons learned. So what have we learned over these past 5 years of working together as a collaborative? The first one is we must have willing partners. We must have willing community partners. PSN is only as strong and effective as its partners doing the work. And we have some strengths in these areas. We have a wide range of expertise in our community partners, and those partners have a history and a long track record of doing good work in Palo Alto. And many of these partners do the work of Project Safety Net within the realm of their normal mission scope of their own organizations. But we have challenges too. Due to the limited resources of many partner agencies, the ability to do more or to work at a greater capacity to meet PSN's anticipated outcomes is compromised without greater staffing or resourcing of those agencies. We need leadership beyond the city, we feel. At present, the city really plays 2 roles in Project Safety Net. One is the unbiased neutral partner, the convening partner, and the city did step up in the beginning to take on this role. And with Rob at the helm for so many years. And the city also delivers some team services. We've hired and managed 2 Project Safety Net directors. The challenges with that is it's been a difficult position to hire. It's been full-time, but there's no benefits, and it's a high level of work. It's a difficult position to have, and leading a collaborative with our scope and outcome is difficult. And we are collaborative with many groups and organizations and parents. We all have our goals, but we have a common interest. So that has posed a challenge to our previous 2 directors. In the absence of a PSN director, the work of convening and holding the collaborative together has fallen mostly on city staff. We have a working committee leadership, and there's work that needs to be done in the collaborative, and it's best done together. And we've seen that work best with different agencies and individuals. We've seen another noticing that we've had is there is value to bringing the collaborative together. When we met with the collaborative last week to kind of debrief after the last director left, one of the biggest noticings that they brought forward is we like getting together. We like, making those connections with other agencies. And they see a real value in building these relationships among other youth-serving agencies. They like learning together, and they value the guest speakers that have been at PSN meetings. But, it's been difficult to find leadership for collaborative committees. We have the one key committee at this point. We've been working for over a year with interim leadership, with Rob being one of them and Becky Beacom being other. And within that committee, they've asked repeatedly, who can take on chair, who can take on chair? And there's just isn't the capacity of others in the group that are willing to take on their role. And I think we've had a real noticing that it's a lot of the same people doing the work, and that's been a challenge. We've done our best to document the work, and Rob's going to talk about that a little bit.
Okay. Yeah, I think that this is lessons learned we're talking about, right? Yeah,
Right.
And documenting the work is very, very important to know where you've come from. And I think the original plan was really good. I think this next step and strategic plan is also a good step. But I would say, on the whole, we haven't done as good as we should have here. And it's partly capacity. It's partly we think, if we can hire a director, that's what they're going to do. They'll do an annual report. We can do better measurement. We haven't had the ability to sort of find the right professional, given what we're offering, and retain them. So some of that hasn't happened. So I think that as a grade for the collaborative, we could do better, and we need to do better. And part of that is, this is if you're executing on anything, you need to have a compelling scoreboard that you can point to, and then it gets people excited about where we're headed. And if you don't have that scoreboard, then things start to wane. And we're experiencing some of that, I think, because we haven't invested enough in documenting our work and measuring it effectively. It's a hard thing to measure, though, right? It's hard enough to measure effectiveness of one organization. Let's just say the city of Palo Alto, and measuring that. Now try and measure, 20 organizations trying to work together in some way. Very, very hard to measure that, particularly because what we hope is that the actual benefit of the collaborative is each organization is doing that little bit more, or doing that work a little bit more intentionally, a little bit better than they would have in the past. And that's hard. It's hard to capture that a little bit. That's documenting the work.
Right.
Was there other?
Yes, sure. Didn't you institute an annual survey?
I'm glad you brought that up. There is several surveys that the school district does. The California Healthy Kids Survey that they've done for some time, but now they also do the Developmental Asset Survey. The plan is to do that every 5 years. The first one was in 2010. That is really good data and helps guide some of our work. And a big part of the reason the district and the city and partner organizations adopted the developmental assets was because the collaborative, was the collective thinking of the collaborative. We needed a common voice around youth well-being. So that is good data.
So it's not an annual?
It's not an annual. That's correct, yeah.
Great. So what are some next steps that we're looking into? And some key questions have come to mind, and you'll see them illuminated on the PowerPoint. So one of the things that we are speaking about as a leadership committee and a collaborative is how can we have the work of Project Safety Net embedded in the community and live within the community? And second is how do we bring PSN efforts into the schools? Because this is where the youth and their parents are already engaged. So we use the analogy, we've kind of pushed from the outside and we've pushed from the inside, but the work of suicide prevention and youth well-being needs to be rooted in the schools, especially on the secondary education level. We really believe that. We need to, in the work ahead, look at a shared leadership model of the collaborative. While the steps just mentioned speak to a series of conversations with collaborative partners, the leadership committee, and with you here tonight, there is day-to-day work to be completed to keep the collaborative functional. With the absence of a director, this is challenging. And as I mentioned in previous gaps in leadership, city staff has primarily taken on this role, and we are willing to do so again, but this is not sustainable on a long-term basis. So this is a key issue that the leadership team will be addressing. So as far as possible opportunities, so we are at a point of contemplating next steps for Project Safety Net. What are some possible opportunities? With the leadership team and with the greater collaborative, we have started the following discussions. One, as a possible opportunity, is exploring using PSN funding to provide grants to agencies and individuals in the community to work on suicide prevention and youth well-being as laid forward in the strategic plan. It's interesting to have this conversation the same night we're having the Greater Stanford conversation. And to what extent are those funding choices factoring in sustainability? And that was also something that came up in the previous conversation regarding the SUMC funds. So that concludes our report. We are here tonight because we value your input and your questions on this matter.
Yeah, it was a bit long, but it was long.
We really felt we were delayed and tardy in getting you a good update, so we wanted to give the extra information for you tonight, even though it might have been a little more than you wanted.
Would you like to start asking questions, Councilmember Klein?
I'll start. I don't know if I like it.
Oh, go for it.
Start with the fairly much discussed. How much money is the thinking that spending per year on what?
Sure. Up until now, we spent about $350,000 of the money. It's hard to say per year, but over the 3-year period of time, about 48% of that has been on staff costs. And I say that's generalized because obviously in the last year that wasn't that much because we were without a director much of the time. I would say 40% of that is on Track Watch. The last couple of years, that expense has been paid for by Project Safety Net. It was in the public safety budget for a while. And the rest on that is just program expenses, miscellaneous, workshops that we support, good efforts in the community that we support, general expenses for meetings.
Let me try a little bit. So in the present fiscal year,
With no director
Right.
and no track watch, I hope.
We have track.
We do have Track Watch.
Just
Yes.
started though, right? Or not?
No,
Hadn't ended.
No, Track Watch had continued. Track Watch has not. There has not been a break in Track Watch since it started. But in this year, personnel costs have been about $17,000. In fiscal year 2015, 2014, it was $40,000. The year before, when we had a full-time director, it was around $94,000.
And all the money is coming from the city, is that right?
That's correct.
Yes.
Let's go back to the executive directors. And did you conduct exit interviews with these two individuals?
Yes, we did.
What did they say?
Well, they reported to Minka, but they said a few things. One key theme we heard was the provisional nature of the hourly position with no benefits was a challenge, and particularly for good people, they have other opportunities. So that was something that they felt was a barrier for staying.
But they knew that going in.
Yeah, but still.
So I'm wondering whether this is this sort of a feel-good statement that it might sort of mask some deeper concerns.
There were other concerns, but I think they were real concerns. We had, with the one individual who came in, her husband had a job with benefits, and he lost his job in that period of time when she was working with us, and that became a very serious issue for them. And it took a while for her husband. That was Christina Urena. But in any case, that was the situation for her personally changed, and that was a reason for not staying. But it is challenging work. There are lots of personalities and lots of organizations, and I think that it can wear someone down. And I think that was another thing that we saw with the first director that was here for about a year, I think.
Mm-hmm. Is there a director search going on?
There is not right now, no. Well, this is a good conversation we're having with you. We feel at this point it's not good money to spend at this time, given the experience we've had with the last two directors. That we should take a step back, talk to the council about options for maybe looking at this a little differently. Talk to the school board, a key partner, and their level of interest and commitment. Are they willing to potentially support a director position or partner with us so we can actually do a different kind of search and have a different caliber individual, potentially, something like that. But at this point, we think it hasn't worked for the last two. We think we need to take a break and reset.
So what were the other concerns other than the compensation?
I would think one of the key things is finding that level of commitment from a lot of the partner organizations that we alluded to in our report, that it was a lot of the same people doing a lot of the work. It was hard to pull people together. I think Project Safety Net has struggled for a while with moving forward, with having individuals and organizations doing really deep dives in every step that the organization wanted to move forward. We're saying, is that wise to do? Is that not wise to do? And there was kind of this paralysis of, oh, you can't do that, you can't do that. And we ended up not doing, many things because there was this micromanagement of each step that was taken by some of the partner agencies. And it really, I would say, as far as Christina, that really wore her down of trying to offer ways to move forward and having, a lot of criticism as far as, well, if you do that, that's not wise, or if you do that, that's not the right thing to do. And when you're afraid to be bold and move forward, then and feeling that each step might be a misstep, it became a real time of, I think, paralysis. I don't know if you want to add to that.
I don't want to speak poorly of the individual that was in the position, because I think she did her best and did as best as she could do. And she's a social worker, and she really wanted to be working as close as she could with the kids, really. But that isn't what this position was in the end. It's about building relationships across many organizations. And, yeah, there are a lot of personalities and some challenging debates that happened. A person that can really hold that and build those relationships and move a coalition this ambitious forward is a really high caliber professional that runs a nonprofit, that type of thing. And that's not what we had funding and structure for, if that helps.
This is an issue that I've brought up several times.
Yeah.
That is, whether this is suicide prevention or youth well-being or both.
Yeah.
And I've paid particular attention to the wording, even in the problem
statement.
Problem statement. There's about suicide prevention is mentioned maybe 2 to 3 times as often as youth well-being, and that says a lot to me. It says to me that the emphasis really is on suicide prevention and youth well-being, the upstream that you referred to, is sort of an afterthought. And please respond to that.
Yeah, I really don't think it is. I think they are equal pillars on this continuum, and there's people around the table that are working on the Project Safety Network that are definitely there for the reasons of suicide prevention, that they've lost children and they're there and passionate about it, right?
But phrase it differently.
Okay.
Why keep them together?
Well, we think this is the right thing to do, and this is not just we. The collaborative thinks this is the right thing to do, because it is a continuum, and all kids are at risk at some way or another. If you think about, I sometimes think about, kids on a cliff. You hear about kids at risk; they're on a cliff, right? But there are kids right over here, way away from the cliff, right? But they're still at risk of moving in that direction, of heading towards that cliff. I mean, really, what we want to do as a city and a community, be thinking about all of the kids under. In our town, and they're all at risk in some way, I think. And so that's how I would answer it. But again, it's we've talked about this with the collaborative members, with people that are there for suicide prevention reasons, and people that are there because they love the developmental assets. And I think, we need safe and welcoming schools, and They think we all should be at the table together because we can learn a great deal from one another. And I would say the majority of people that are really active and participating are more in the upstream sort of camp of youth well-being than the downstream.
And I would just add that, that's one of the key reasons why we did the strategic plan, to answer that tension of what it should be. And it wasn't that, the leadership had a vested interest. It needed to be one, it needed to be the other, it needed to be both. We tested this with, the collaborative members. We tested it with the working committee. We tested it with the leadership committee to really say, okay, we had the opportunity now to maybe look at it a little bit different. Should we? And the answer that came back is, as Rob explained, we really feel like this is a continuum. There's energy in the room as far as seeing the value of having and the need to have those two issues together.
Well, tough question for you politically.
Okay.
Are you really getting cooperation from the school district?
Why don't you ask them a harder question?
That's we have some really good people working in the school district, and some of them are here today, and they're working hard every day for the support of youth well-being and suicide prevention. So I would answer it in two ways, I think, and Minka, you can help with this. I think yes, in this way that they've adopted suicide prevention policies, they've adopted the developmental assets, they're working hard at each school in terms of the safe and welcoming environment. There's activity happening there in support of these initiatives, and I think that's really important work. With respect to keeping the collaborative together and helping sort of guide and vision where we go as a community, less so. I think that that work has fallen to the city largely to manage the collaborative effort. We would like to see a greater commitment from the school district, I think, on this work. And even beginning with this sort of conversation about who leads the work. I think if you ask most people, they see the city as really the lead. And we really meant to be equal partners in this leadership role. And I think that the city plays an important role as the convening partner and somewhat of a neutral partner, and that's important, and it's been important. But I think we'd like to see the district play a stronger role in terms of the programming piece and services piece and financial contribution to having a collaborative like this. What is the value to them? And if they contributed financially, I think that would be a good thing.
My last question gets back to finance. Well, next to last question. We have $1,700,000 or so, and you're spending money at right now at less than $50,000 a year. I think that means you have money, assuming no interest at all, at least for the next 34 years.
Well,
that doesn't seem like the best use. So do we have plans where we would spend the money a little bit more aggressively than what we're doing right now?
I think so. I mean, I think the plan that we sort of laid out for you today, the strategic plan has a really compelling vision of what we want to do and what these anticipated changes are. Our interest is, I'm curious what you think about this, and Jim as well, and others involved, but we'd like to see the funding be made available to our partners. Not the least, Lucio Packard was here earlier, but adolescent counseling services, the YMCA, youth community services, these are the groups that are boots on the ground doing the work. Now, the city's doing some of this too at our children's theater, at a teen center, at the arts center, other places. But these partner organizations are the ones that really are doing great work. And I sort of would go to your question that you asked earlier to some of the partners, is to ask them, what can you do to further this mission that you can't do now? And then have some process where we could evaluate that and then give them some additional support and funding.
Yeah, we really feel there's a lot of excitement in the possibility of granting out the funds to our partners. And the manner in which we do so, that's very, apropos to the other discussion tonight, matching funds, one-time investments, capital things for purchases. But we really feel like it is a wise and use of the money to have it go directly to meeting the needs out on the streets instead of using that funding specifically for a program director for that kind of administrative capacity of the collaborative, I think we can look and have really strong conversations with our partners to say, you know, instead of a full-time paid director, how can we look at shared leadership, you know, of the collaborative? Can there be turn taking of leading the collaborative meetings, you know? And there was some very successful models that members in the collaborative have talked to us about of shared leadership as far as the coming together of the collaborative. But we think it's really key that we'd like to see the money out there in the community doing the work of suicide prevention and youth well-being, and we think we have a real opportunity with the Stanford money to do so. And, you know, we're here to seek your feedback on that.
Wouldn't that sort of mean the end of Project Safety Net, and we would instead use these funds to support a whole variety of organizations and or programs for whatever period of time that that money covered?
I don't see. Go
ahead.
Yeah, I don't see, especially because I think there's there are still some core aspects of the collaborative that we could still hold together, as I mentioned earlier, that aren't really have great costs associated if we look at it at alternative ways as far as bringing the collaborative together. So I don't see it as an end. I still continue to see a role of the leadership committee. I still see bringing the committees, bringing the collaborative together on a regular basis. I still think there's a need for some of the committees. I mean, there's work that each of these individual organizations do, but the work that we've primarily set up for the committees of Project Safety Net has been, what are efforts that span different committees, different organizations that need a different, way of meeting that could bring people together to address those needs. And that's what we really looked at the committee level. But so I think there's some alternatives we can really look at.
I would add to that. I think that what we would get a different kind of proposal as to what to spend money on. If we didn't have a collaborative where we were bringing these folks together with this common interest in youth well-being, we would have a proposal that would be somewhat independent from adolescent counseling services or the YMCA. But because if we can do it, if we can hold the collaborative together and keep these folks coming together and building relationships together, that the proposals about what they could do that they can't do now would be much richer and deeper in terms of their collaborative work with other partners in the community. I think we'd get a different set of proposals.
There's also the opportunity with the funding to say these are key aspects of the work that the collaborative needs to hold it together. One is, the whole mental health section of it. Well, maybe one of the grants that we give out would be to a partner with expertise in mental health that would say, we'll take on the work of that committee, with the assistance of grant funding in this area to be able to move that forward. So it kind of still moves that committee work forward, but it's not completely, volunteer or city staff led as it has been a little bit in the past.
I'm done.
I get the impression that you're asking for a change in program. I guess up to now I've seen that we've been funding the infrastructure for the collaboration, and that there's a number of community partners who have a deep and lasting interest in this. Counseling, Lucille Packard, Palo Alto Medical Foundation, PAUSD, the parent community, adolescent counseling, each of which have a piece of this, and the collaboration helps it work together, and that's been the role of the city to make sure they're focusing their attention on this. You seem to be raising the issue, though, that now there's a new strategic plan that has specific goals, that the other organizations are saying, gee, we don't do that. We would need new funding to do what is being asked in this new strategic plan. So that seems to be a change.
No, I think it's I don't think it's it's kind of two things. I mean, it's enhancing and supporting the work that these agencies are already doing, but it's asking them to really look at the strategic plan and say, you know what, my agency, has impact on this anticipated outcome that you are trying to reach. But to be able to move beyond the capacity that we have, we really would appreciate an investment to make that happen. And that's what we're really looking at.
Mm-hmm. Yeah, and the partners helped create the strategic plan. They helped write it, and it was sort of looking at best practices across the country around youth well-being and suicide prevention. So there will be new ideas for them and new investment for them to do even better work than they're doing now because of the strategic direction.
I guess that's a step that's different. They say adolescent counseling service has been operating for 50 years, trying to reach youth, adolescents, mental health issues. But now they're saying, oh, we can't do that with our current resources.
They're doing a lot of work. Are they doing everything that they can and hope to do? No, they're not. They're a nonprofit that fundraises like any other nonprofit. So they're constantly looking for additional support.
Yeah.
They can be doing more.
So the bottom line, though, is you think that we do need a larger investment and more funding to help the program achieve the goals that have been identified.
Yeah, I think that's true in both the, I see it more as the community partners truly, really investing in the leadership of the collaborative and sharing in that leadership. In some ways, with the city being the only, financial contributor to the foundation, that's not a great model, I think, in the long run. We need everyone to have sort of skin in the game, particularly the bigger organizations, if they believe this is worthwhile.
I guess we just had an example of a parent group rising up and saying, gee, art can play a role here, and we'll do it. And they establish, their own little group, and they're running sessions for 200 kids and feel that it's contributing.
There's lots of those types of stories, and youth speaks out. The art it probably wouldn't have happened if it wasn't for sort of the collaborative process, because one individual can't do very much.
Right.
And they needed mental health services in the classroom because they were reflecting deeply, and particularly during some of the suicide periods. So they were surrounded by support with the members of partners within Project Safety Net, and it allowed for a team to come together and actually make that happen.
Right.
And there's a lot of stories like that. I think some of them are in the staff report.
Hey, thank you. I wanted to make a few comments, observations. I very much and deeply appreciate the work of all the partners, and I think that's been very important. I think there is a need for continued work in this area. It is complex. I do see the spectrum we're talking about, not separating suicide prevention from mental health and well-being issues. It's very complex, and there are a lot of factors which contribute. I guess I was concerned with the recommendation not to rehire a project manager or whatever title we're talking about here, because it seems to me without that focus, it would be very hard to continue to have some successes. And we've been talking about different models that could be considered. And I guess one of the things I wanted to observe was that the shared governance model, without the funding to go with it, meaning funding by the partner agencies, makes this continue to be something that's under the auspices of the city. And this is a community-wide issue with key players and key partners who have expertise. And so I guess one of my questions and concerns is, have we really looked at models? So, for example, I keep hearing about Redwood City 2020, which is a collaborative that's been in existence for 20 years. It has partners, and they all contribute. I don't know if it's a 501c3. I'm not sure. they all contribute resources, financial and otherwise, to ensure that the position is funded, that their efforts are coordinated, and they're able to achieve things in the course of their work. Now, you have a great strategic plan, and I very much respect all the people that have been involved in this cycle as well as the earlier efforts. So we have the foundations for a work plan that has some meaning. But I think if we don't look at, other structures or models that look at this a little bit more strategically, meaning accountability, resources, and funding, then this model won't be sustainable. Because eventually, as several people are pointing out, the money will go away. So it seems to me that we need to look at other approaches. So, for example, we've talked full-time, we've talked part-time, we've talked benefited, unbenefited. There are issues. You can have a benefit for how do I put this? You can have a stipend for benefits that doesn't put us in a long-term commitment to retirement, pension, et cetera, as within the city structure.
Right. And that's something we did with the last two employees. There was, after a certain type of employment, there was an increase that they could put towards health care, days off, and things like that. So we were looking into ways of, even though the position wasn't benefited traditionally, we were looking for ways of, making the position attractive, stipend towards health care and so forth. But in the end, that wasn't enough. To answer your question, I think with the leaving of the last director, I agree. We haven't had all the conversations that could be had about alternative models. This is the conversation of granting out the money. That's something that we've had initial conversations on, and we wanted to get your input before we went any further, because as the grantor to us for these funds, we didn't want to go too far down the road without getting your input on this. But there's more conversations that can be had. I will say, just as an aside, that there is a real desire as part of many members of the collaborative to just get the work done. We had the 2009 plan. We did the MIG organizational plan. We have our strategic plan. And I think there's a real desire to say, okay, you've done a lot of planning, you've done a lot of organizing, let's do it. And for some on the leadership committee, the granting of these funds to partner agencies in the community was a real hands-on way of saying, yes, we are doing the work, we are supporting the work that needs to be done to reach these anticipated outcomes. But I would agree, we haven't had all the conversations that we possibly could have on this. The Redwood City model, it's true. I mean, that's a collaborative that's long-standing. I believe each member that's part of it pays $20,000 a year to help pay towards the salary of the executive director. In our case, it's just the city's funding that is going forward. So, a novel idea could be using the city fundings and partnering that with money and benefits that one of our partner agencies can provide. And then we have a full-time benefited person leading the collaborative. We are definitely open to options such as that.
Because I do think that is an issue. Could the position be embedded within a nonprofit partner? Could the nonprofit come up with a benefit
Matching
package?
funds?
Matching funds. Because I personally am saying the issue of matching funds and financial engagement as it relates to sustainability of these efforts, in my mind, is really, really important. Otherwise, we will become a granting agency, which over time will have fewer resources to use. And I guess that really worries me. I think this is a community-wide effort, and I think we need to look at the delivery of that service a little bit differently. And I want to hear how the rest of the committee members feel. It just seems that without a center to the hurricane, it's going to be tough to continue to make really important contributions, because there's a lot at stake here. This is huge. And I think we can learn from how other communities have done things like this. There are not project safety nets everywhere, but there are comparable efforts and collaboratives. And what can we learn from them to make this work better, feasible, more accountable? And I personally am very concerned about the sustainability of these efforts. So those are my issues. I'm sorry I jumped in before I gave you a chance.
No, I'm glad
but
you did.
I've been writing and thinking about this for years, and I had to jump in here. And also, I think we need to hear from Jim Keene. But why don't I defer to my colleague first, and then we'll go from there.
So I really appreciated what Gail said and what Larry said and what Greg said. So I really don't mean to be harsh, which means I'm going
okay.
Let me take a drink of water first.
Exactly. You know, I am deeply troubled by this, and I guess I'm deeply troubled by that I feel like I have to read between the lines to understand what you guys are talking about here. So what I'm getting out is that the current model for Project Safety Net is not working, is not achieving its goals. The important part to take out of this is to keep the collaborative together, and there's a lot of value in the collaborative. But the other people in the collaborative are not necessarily willing to step up and put money into it as they are doing in Redwood City. And that strikes me as an interesting issue. You're talking about becoming a grant organization, which seems to have nothing to do with my original vote to put money into form a Project Safety Net organization, and I would probably oppose that unless you came up with much more clear arguments about why we should become a funding agency as opposed to supporting a collaborative. I was not pleased with a staff report. I don't like staff reports that do not put up front what the decision to be made is. I'm still unclear what the decision to be made is. I'm unclear when you ask, the problem statement is the Palo Alto community struggles with the pain and loss of youth to suicide. There is urgency for ongoing coordinated community action to promote youth well-being and suicide prevention. Larry asks you, that's the problem statement. Isn't that this is what it's about? You say no, it's about other things. But this is your problem statement. I think that's poor drafting. Okay.
No, I don't think it's poor drafting. I think it says what they really are after.
It's muddled thinking. How's that? It's not clear as to what you want from me. So then we get to we get to possible opportunities, fine. And then somewhere in here we have next steps. When you come to me, next steps are not questions. Next steps are policy decisions. How can we work with the work of PSN, be embedded in the community and live with the community? I'm not here to dream. I'm here to make decisions upon having good staff work that says we have these opportunities, we can go in this direction. You know, Redwood City's doing this. We could put more money and fund an executive director, but it's going to take a benefited position that's going to take this. Do you want to spend the money to do this? Or we can dismantle the whole thing and become a grant organization and, you know, basically figure out how we keep the collaborative together. Or we could keep the collaborative together and split off the funding and use the funding for something else. You know, I guess I want choices that have staff back up and say, what are we supposed to do here from an analytical point of view? And I haven't seen that. How do we bring PSN efforts into the schools where the youth are and where the parents are? That's staff's thoughts. You have to give me options. You can't ask me, how are we supposed to do this? I have no idea how we're supposed to do this.
Oh, darn it.
You know?
I thought we were going to give us the answers
Well,
here.
right. No, I mean, that's the point.
No, but I think this was really intended to be more of a study session and an update. We were not coming to you asking you to make a decision at this point. We haven't come back and talked about the strategic plan, so we needed to do that and sort of walk through the process that we went through. And I appreciate the criticism, but it's criticism of a lot of people and all the partners in Project Safety Net. You know, a lot of people put a lot of hard work into that strategic plan and the strategies and anticipated changes. There's a question about how we really execute on it, and we're struggling with an answer on that one too. And what is the city's role in all of this? Sort of a fascinating question, I think, about the health and well-being of youth.
If I could just raise a specific issue. It seems to me that there's a critical partnership at the core, us and the school district.
There is.
And it seems the next step is really to have a conversation with the school on where are they,
Right. And we just lost the last director. We didn't think that we would be at this point. Now
Right.
that just happened. So now we're we're concerned about the path forward.
Right, I just want to know what we should do. I mean,
Yeah.
what are the options we have? And I realize it's frustrating.
Yeah.
I'm just not sure where we go forward from here. And I don't think that the grant funding model, it seems separate than the notion of keeping the collaborative together.
Right.
I mean, it seems, is the school district going to partner? I mean, I think Councilmember Schmidt's correctly right. I think Councilmember Price raised the issue. What are other cities doing? How do we achieve our goals and what? And before you can figure out how to achieve our goals, I think Larry's right. You have to say, what are our goals? I mean, what are we actually trying to achieve here? And it has to be, concise. And I didn't feel that that's what did that.
Okay.
Yeah, should we, do we want to hear from Jim Keene, or do you want to comment?
I'm happy to hear from Larry.
Okay. Let's
Could I borrow your mic, Greg, for a second? So first of all, I agree with, 90% of the things that have been said, and I certainly agree with what Greg said. I have to defend the staff a little bit in this regard, that it was about a month ago we were here, and so they've run off to try to put this together in the midst of doing their day jobs. And I would also say that it's really a part of this challenge is really outside of their experience and expertise, partly because it's a huge challenge. And I was making some notes just trying to think about this, and some of the language and everything. Project Safety Net. I actually think Project Safety Net has kind of a double meaning. One aspect of it is probably the typical way we would think about it is this safety net that's designed to kind of catch youth who are falling, right, and help save them. But the other is a sort of net that's trying to hold people together also who are involved in the community basis that has to exist in order for there to be human happiness. That's what we're really talking about. So that's a big challenge, say. How do you ensure human happiness in a community when there's a continuum of how people experience that, and what's our role? And so I think there's always been this tension all the time about this collaborative, which is this sort of this net that holds these different people together. But they're there for this bigger purpose even of how do you save youth or whatever from falling through the net of life. And we don't have the answer to the real issue. This whole initiative was born out of a crisis response in the moment, and all of us not knowing what to do, just all had to kind of get together, and we took it on as a sort of the convener and the glue. And the truth is, that's been very effective, but I think even from the beginning we knew that isn't what the end is. In a lot of ways, a collaborative is an activity. It's not a result. It's not an outcome. We want happier children in this community. And how do we do that? And I think the reason I think there's a lot of tension is the council members, too, are saying this is such a big issue, and we only have $2 million. And how's that really going to be parsed out in some way that's going to result in something? So the questions about, I completely agree that we have to have much clearer expectations about what we want to do. I think we need to think about ourselves more as VCs than a granting agency that is thinking about what's a startup or an enterprise that is coming that actually can give us a proposal that will actually take over this in some way that sustains this. I mean, we don't have enough money to, in my view, to give out for the most part and have it do anything other than do some good for a little while and be gone. And I think that's what you all have been wrestling with. I think even the effort the last time to talk about should we invest in capital things just because we could know they would last, or how do you sustain them? So I just think we need to, and one of the things I was thinking about when I was listening to this, and I think this is an important question. What conversation will we be having if we had no money at all? Because pretty soon we won't have this money. And this is really not about the money, but so we're almost like somebody who won the lottery, you know what I mean? And suddenly, you know, you turn around and 5 years later you say that they had no money and their life was even worse than before they had the money. So that's what I think, and so I think these questions about who does have to be involved, almost the money is secondary. How are we going to ensure youth well-being along the whole way, going back to Larry's very early point about where's the emphasis and what's required of that without being driven by the money. And I think the money can be helpful, but as just seed funding. I don't, with an expectation that there would be an explicit expectation of the specific return on investment. And it probably has to be in some particular niches, because otherwise, if we just spread it all around, I mean, I don't think we could say what the results were at all. So I haven't answered it, but I think we do need some basic policy direction from the committee. In other words, don't do this, at least. We're not interested in that. Don't waste your time. We think maybe there's something over here. That's what we want you to do. Now go back and be more definite, you know. And to the extent that you can give us that, I think I can help these guys a little bit fulfill where you are. Because right now they're kind of running back thinking, you know, I don't know, gosh, what are we supposed to bring back? And maybe we keep it going. So thank you.
Councilmember Klein? I think the city manager's comments were very, very helpful. Thank you. Can hardly wait for the new sound system in here, but I won't see it.
We'll bring you back for the reunion tour. It'd be like one of your grandchildren that get to actually play with the mics and stuff.
I do struggle with the youth well-being. You haven't made a persuasive case, so I've been thinking hard about it. And using your spectrum idea, and also building on Jim's happy children idea. There's some percentage of the kids in town who are happy children. And Project Safety Net has not been addressed to them at all. We have all types of organizations that talk about, that do things for the, quote, happy children who don't have any particular problems, ranging from the Little League to the dance club to the chess club to the robotic club to football team to cheerleaders, all of those things. Now, there may be some kids in there that do have problems, of course, but we have in many, 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 many organizations, city and school, that deal with whatever percentage of kids are that don't have problems. I'm reminded of, Sherry, what's the number? I remember going through your program at Children's at Lucille, where the speaker said something like 95% of the children who are born have no physical problems. We deal with the other 5%. Right. So using that type of metaphor, Project Safety Net is really focused on, pick your percentage, 10, 20, 30%, I don't know, who either have potentially suicide problems or at least need crisis intervention help, who need some type of advice because they're struggling in one way or another. So maybe we need to, at least to make me happier, to really define things more precisely. Because the language over and over again says to me, you are not in the youth well-being business. Project Safety Net is not. Maybe it's in what I'll call crisis intervention business as well as suicide prevention. I'll definitely buy that. To me anyway, the words are important because it helps define what you really want to need. Different trajectory, dealing with why is it that the city is funding it all and Redwood City gets organizations to put money in. I think the answer is that's the way we started, and people are used to it, and trying to get people to change once, and the city's got the money, so even for organizations that perhaps could afford the $20,000 a year to use the Redwood City model, it's going to be really hard to change that. But I did want to talk, Gail said something that made me realize I wasn't explicit enough in what I said earlier. She took my analysis of the finances and put it in the other direction from what I intended. Got $1,700,000. If all we're ever doing is just funding Project Safety Net at the level we're doing now, and we get interest on the $1,700,000, it's a perpetual motion machine. You'll never run out of money because you make 5% a year. That's $85,000 a year, and you're not spending $85,000 a year. But I don't think that's not my intent. When I voted to fund Project Safety Net for the $2 million, I expected that a good part of that would go for personnel, because if not, then we're turning into a funding organization. I could certainly say to myself, okay, we have $2 million, 5% a year is $100,000 for of income, and we're going to spend roughly $100,000 on whatever you want to call it, on a director, or and maybe we spend a little bit more, but we can handle that out of our general fund, and so on and so forth. But now we have a model that, to me, doesn't work financially in a very, very different way than we usually mean. It means that right now we're never going to spend any of the money. And I think we have an obligation to our community to, we've certainly got some problems, and our goal is not to build up some money for the 22nd century. So I think we need to have to come back with something that says either we're going to have a beefed up Project Safety Net with an executive director, or we're going to retreat to being just sort of a collaborative, whatever that really means, and become the city becoming a granting agency for other youth programs of one kind or another, suicide prevention, crisis intervention, and so forth. And I think staff's got to come back with, I'm agreeing with Councilmember Scharf here, that with some more precise questions as to where you want us to go. And one last thing, yes, I was bothered by the sentences. How do we bring PSF efforts into the schools where the youth are, et cetera, et cetera? Wrong body. Go about a mile away.
I did. Okay.
Yeah, just a slightly different take on it. I don't think we should focus on suicide. I think the well-being makes more sense. We're dealing with kids, not just the 1 per 1,000 who has suicidal tendencies, but those with stress, depression, angst, the 5 or 10% who might have life issues around it that can emerge in a lot of different ways. So it's bigger than just trying to deal with the 1 in 1,000. Now, I think the success of Project Safety Net clearly has been this collaboration, and there are organizations out in the community that are devoted to dealing with mental health of kids. Lucille Packard has some activity with Stanford, the Palo Alto Medical Group, Adolescent Counseling Services, Youth Services, Youth Speak Out, Partners in Education, certainly PAUSD and their counseling sessions. So there's a number of organizations that are devoted, and I think one of our key roles is to try and build a collaborative effort out of that focuses on the 5% that need help. But I think of that group of organizations, I can see none of them are going to stand out and say, oh, let me be a leader, let me be the funder. I think the two organizations that have the critical responsibility is the school district and the city. And I think that's the key relationship, and I think starting point is to sit down and see, do we have a partner in the school district? And, how far does this partnership go? The second thing that comes out of that might be a single page on a structure of how do we provide the structure that's needed to make this work going ahead once we find out whether we have a partner or not. And maybe the third element is a budget that says, okay, if we have a partner and we are going to have this kind of structure, here's the commitment of funding that's needed to make it work. And I think those three elements are three key steps that we could have moving forward.
Okay, I wanted to comment. I feel very strongly about this issue of being very careful about how we characterize mental health, mental illness, wellness, suicide prevention, suicide ideation. Please, students who have had suicide ideation or who have taken their lives often were children who were very high-performing, happy, by all other measures, were very successful in their lives. They had friends, they had loving family members. They had community members who cared for them deeply and still care for them deeply. It's not as simple as happy kids, not happy kids. I know you were trying to figure out a way to describe this, but the pin I'm wearing here is a pin in recognition of brain research. And what we're talking about here is a disease in some of the most extreme manifestations. It is a spectrum. Huge percentages of individuals and families experience mental illness, from everything from mild depression to debilitating depression, and this impacts their ability to operate in the world. And I think we have to be very careful about what we're talking about here. It's not simple categories. You're either this or you're that. And we're talking about people who are complex. So I think the fact is there's not one panacea, but an individual's wellness covers a huge spectrum. And the other issue about the project statement, my colleagues may or may not know that people worked very hard over many years struggling with these issues. And at the end of all these strategic plans and this and that, this was what they felt was an appropriate presentation of concerns and issues. Because people are at risk to varying degrees. And so we're talking about different kinds of strategies, education, reducing stigma. And so my plea here is to be very careful about how we're characterizing these situations and the lives that are impacted. So I think we do have to, I ask my colleagues just to think very carefully before, we're making statements that are sensitive to the complexities of this. And I see people in the audience, I know people involved in this work, that we have to be very, very careful about how we're characterizing this. And I appreciate how hard it is. I know how hard it is. But I'm just asking people to be a little more aware and sensitive about comments being made. I felt I had to respond to what I thought was an oversimplification of the issues before us. I couldn't sit here and say, well, if someone's not happy, then they do this, and by all measures, people are experiencing other, their lives are complicated. I'm just asking people to be aware about how they're talking about these issues. It's not a specific proposal, it's a plea for awareness.
So I actually thought that was very well said, Gail. I actually really did. And I do think it's a very complex issue. And now I'm going to say that I actually feel for staff when you go through this process, because it's very hard to be equipped to handle these issues, right? And it's very frustrating, and I recognize this. So what I'm trying to tell you, and I guess I may not be as clear, is I want to know that we're spending the money wisely. I don't want to think that we're just spending the money because we have the money. And what Larry left out is the third alternative, which is let's have the collaborative and let's use the money for something else. Oh, I didn't think you used it. Let's not spend the money. Let's.
No. I want to. I thought it was very clear. Anyway, then they get it.
You know.
But how do you handle the collaborative? Someone has to organize the efforts.
Well, right,
Anyway,
but if you're not
all
going
right,
to,
all right.
but the point is if you're not going to have an executive director organize, maybe there's another approach to organizing it.
Right. I'm gonna look at that.
And I'm just saying, let's look at the options, see what they are, and, you know, come back to us with that sort of a plan. I do not see us as a funding agency in this. And I actually don't necessarily agree with Larry 100% on that. I'm fine to say we have $2 million if you told me and we were going to make $100,000 a year, and that $100,000 combined with, you know, money from our partners who are collaborative will now have a system where the next 20 years we will have a collaborative, and all they know is that Palo Alto is going to put $100,000 towards that structure, but they have to step up as well. I actually was struck by our partners who spoke earlier that other people have to have skin in the game, and that's why we asked matching grants. And it might be tough to move the culture there.
Exactly.
And I'm perfectly fine with the $2 million as that's our skin in the game, but it's $100,000 a year. And if you guys want to step up, great. And if you don't want to be our partner, you don't want to collaborate with us, or you're not going to be, then this doesn't work, and it's not really a collaboration.
Yeah.
So anyway.
It's all good feedback, and we're trying to figure this out ourselves. And I do think it's an important challenge that we're trying to do here in terms of bringing the community together around suicide prevention and youth well-being. And I firmly believe it needs to be both, and I know our partners do as well. But it's hard. It is hard. And it would be much easier for me to go back and say, I'm just going to manage the children's theater, the teen center, the aquatics, and the parks. And hey, man, I know that stuff, and it's that. But to do this,
the golf course,
Oh, he wants to forget
thanks
that.
for bringing that up. It was intentional, but
It was intentional.
but the idea, yeah, for now.
Is it a mini golf course?
Yeah, almost.
Yeah, there's a space up there in Redwood City.
But it's like what is the city's role in sort of this sort of convening agency within a community that brings people together around social issues? You know, I think that's, you know, there's some really good there and some answers there, but it's got to be done well, and it's got to be done with partner commitment, and we haven't quite found it yet, but I'm glad we're working on it, even though we don't have it quite right.
And I would say I'd appreciate the really direct feedback. I think that's helpful for us. I think due to timing, I agree with you. Some of these were questions to you where you are the policymakers. I completely agree with that. I think being thrown a little bit off course with the leaving of our last director and trying to get you an update and trying to just let you know where we're thinking, I think it came off a little bit different than we were intending. You know, we know our role in this, and we know the kind of things what we want to do, but we want to be responsible stewards. You have graciously gifted this money to this effort, and we just wanted at this point in time to get your feedback, and I think we've heard some really good feedback tonight, and I really appreciate that.
Thank you.
So what are the next steps?
Well,
In coming back to us?
We need to huddle, obviously, with the city manager, sort of reflect on this feedback, a courageous conversation with the school district, clearly, and then, you know, come back with some specific options for the path forward, right? I mean,
Yes, sure.
Madam Chair, so I feel that we started drifting a little bit into the other item in your agenda about sort of mission and sort of guiding principles and that sort of thing a little bit here. I'm just sort of wondering if and when we get to that, you know, that I don't think if there's a sense that that's not clear enough, I don't think the staff can go out and go too far without getting more definition in this next part of the discussion. I'm not saying you define it tonight, but if you're gonna want us to want more work on that, I think we ought to wait to see that before we could say, well, we'll be back by such and such a date on this stuff, because I think it's going to be informed by what you say. Now, I think you've said a lot of that here tonight myself, but to the extent that you want to add to that, if we could just sort of keep that in mind.
So now we're on item 3, is that?
Yeah.
Yes, Councilmember Klein?
I see project safety net being in a different category. I agree with you. Council's already set aside $2 million presumably. And I think before we can go any further with how we're going to use that $2 million as compared to all the rest of the money, we need to know where we're going with project safety net. Right. I think that you've got both the chicken and the egg right now.
Yeah, right.
Well, on that aspect, because we, the rest of it, I agree with you on that.
Okay. But it could be that the larger than discussion could even reframe even how much money you wanted to go towards Project Safety Net or Youth Wellbeing, even, whatever. I'm just theoretically.
No, but it could, but
Right.
we need to have you come back and say, okay, suggest some model, and then we'll know. You might think of ridiculous. You might say, oh, we only need $1 million for Project Safety Net, so you've got another $1 million to put into the whatever else. But if we establish the general principles for health and welfare, adding another $1 million is going to change it, I don't think.
So I have a question for you. Are you suggesting that preliminary efforts could be made on the guiding principles, mission, and objectives for the use of the Stanford Development Funds?
Yes.
Simultaneously, yes, I think so.
Other than Project Safety Net.
Right. And I think that that is important, because if we defer that discussion, then the resources within that fund will not be used or
Right. No, I think
leveraged or matched or anything else. So I guess the question is, we're always back to staff capacity, aren't we? So I guess that's a question to work with Jim Keene on, in terms of the how quickly both of these items, and they are related, can come back to us. Jim, the issue of proceeding on 3, we could have a brief discussion now. Do you feel you have enough information to start putting the structure and bones to the issue of guiding principles, mission, objectives for the health and safety funds? Is there a staff capacity issue here? How do you imagine this moving forward?
Well, it's misusing the metaphor, but it is still a chicken and egg thing, which is there a sense that, from your view as the committee, that you think we need some more explicit guidance or boundaries drawn around how we ought to be thinking about this? And if not, then I think we would be willing to go and make a next cut at this.
This being project safety.
Well, no, I'm hearing the larger question.
Yeah, that's what I agree.
Right.
Yeah.
Right. I mean, so I guess we keep going back and forth. You feel you have enough information based on this conversation to address agenda item number 3? Or do we need to talk about that a little bit more? And then there is a staff capacity issue and
Right.
being able to address all of these
Well,
things.
no, I think we should talk a little bit more, and I guess this might be my bias. I would imagine that some of the thinking about the perspective at how we look at Project Safety Net, some of that would carry over to this other one also, would be applied in a different way. But you might sort of say, for example, we want to spend all the money, blah, 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 or we want to be sure that we spend it wisely, that we are looking at different options. All of those things I think you would say for the other $2 million of health and safety, I'm assuming, but then you may have other things that you want to add. So, I mean, I don't know if there isn't some, it would be kind of interesting whether or not we couldn't mine some of the committee's thinking concurrent with the work we're doing as a staff in an ongoing way, whether or not, I mean, I just ran back here to the ask the city attorney. Sometimes you've spun off a little subcommittee of a couple of you if you're ever interested in doing any of that sort of thing. You have a process that lets a couple of people put some things together. I don't know if you were interested in that, but it could be helpful to us while we're working in parallel here, so that when we get back to the committee as a whole, we've got some more, we've leveraged some of your thinking.
Right, we had talked about that as a possibility. Councilmember Klein?
Well, I think we ought to, yes, I'm comfortable with the committee idea, but I'm also comfortable with us setting forth some general guidelines on the non-project safety net $2 million based on what we've heard tonight from our partners, such as I think that the basic decision is whether we use this as an endowment or try to spend it. We faced that question earlier on our other aspects of the Stanford money. We made a very clear decision that we weren't interested in an endowment. Maybe this is different. I don't know. Then you have questions like matching grants or not, so on and so forth. I think we go down 4 or 5 items and make some basic decisions and narrow.
Colleagues, are you comfortable with that? We could lay that out and start with that, and then if we need to spin off in the future to a subcommittee to do some more work on it, we could. So do people concur? Okay.
Just one clarification. So item 2 is done, and you have enough information to move ahead on item 2.
I'm not sure I have enough, but we'll certainly regroup. And
I'll jump into the hot tub with you.
Yeah.
Thank you for the feedback. I'll be over at the Parks.
I didn't want to jump into boiling water.
Is this a trip to Essalon?
Thought it'd make it.
Okay. Thank you for your hard work
Yes.
over these years. We really appreciate it. Okay, so
8 o'clock, I'm just letting you know.
8 o'clock.
Zip through some of these things. I think
Okay.
look like you've got some thoughts.
Yeah. I think, colleagues, who wants to start? Larry took a running start.
I don't know where Larry went.
I don't know. Well, let's keep going. Okay, so do you want to make some comments?
No, I want to wait for Larry.
You want to wait for Larry? Okay. Councilmember Schmidt, did you want to make comments?
Okay, starting on number 3.
Starting at number 3.
What I heard from the earlier discussions was that it makes sense to think of these funds as one-time only funds, not as funding programs. I think the areas that make most sense are focusing on types of things that are city-oriented, outside the purview maybe of a lot of organizations. Maybe the first thing is, how do we help people get access to care who currently have problems or troubles doing that? Second thing then might be to focus on issues that are the responsibilities, or at least in the purview of the city. And I think of homelessness as being one that has come to the council a number of times over the last 3 years. There is a responsibility of the city to deal with people who live in the city. So I think that should be one. I think there was a very interesting comment made for the elderly, called Healthy Cities, of how do you think about designing or planning a city that offers the types of things that elderly people need. And maybe as part of our comp plan, we could just actually hire a consultant or something to go out and to identify those types of things in planning a city. Mention was made of walkable areas, buses, cabs, benches, access, mobility, all those issues. If we have an increasing aging population, what are the factors that we as a city ought to be thinking about to integrate those in? So this grant wouldn't be to fund them, but maybe to get someone to help us design the types of things we might think about. One other thing occurred to me. This is health and safety. And part of our community needs that I'm not taken care of so much by anyone else is emergency preparedness. Is there something that we could be thinking about or funding on the emergency preparedness side that would help us as a community get better prepared, whether it be communications or supplies, mobility, inside set of issues covered by our so these are the 4 areas.
You want to go first? You want to? So I was going to say, I think that we should go with matching grants. I think it would be a mistake not to go with matching grants. I think we should make it clear that it's a one-time only funding source and that we're going to spend the money. And I think it needs to be impactful and meaningful and measurable. The 3 M's: meaningful, impactful, measurable. So I'm very, and I think city-oriented is good. I also think we should have a, what do you call it? A preference, I guess is what I'm thinking. I don't want to say it has to be, but a preference for the elderly, frankly. I think this is a good opportunity to provide better elderly services. I think that's something we need. We are an aging community. And so that, and I don't want to be too, what's the word? I want people to come forward with different, innovative thoughts. I liked some of these things that the CDC has. Use of evidence-based interventions, encouragement of innovative practices with thorough evaluation. I thought some of these things, that's on page 5, packet page 342, evaluation to form a continuous improvement process. But since it's one-time money, it's not like I don't think it should be that we just increase funding for a particular, and then those people get used to it, and then we pull the funding. That's a bad model. You're much better to say, frankly, let's set up the gym that's then sustainable for Avenidas. I'd be much more willing to look at something like that. Or to, let's say, let's fund a space, let's fund a rooftop garden at Avenidas. I mean, I'm just using these as examples because you mentioned them, where they're real, concrete things that at the end of the day, the community now has something it didn't have, and it lasts for the next 20 years. So that's my general thoughts on that. See what everyone else thinks.
Thank you. A couple comments. I was going to reference the CDC, Center for Disease Control and Prevention. In the discussion of mission and objectives, I think that staff could certainly draw on that as an idea. I would also say the looking at the healthy cities initiatives. There's a whole kind of series of policies. Some cities adopt the Healthy Cities initiatives, but what I'm saying is you can draw from that in terms of ideas that make sense. I think we should open it up to some program money for example, special projects that don't require ongoing operating funds, because I think there are times, if we just look at capital projects or, those kinds of things, they're very valuable. But I think if we really, there are some elements here that the providers and the partners have identified informally or formally that could be very useful. So I'm not sure that we should keep it simply on a kind of a capital. I do agree on the one-time basis. That's why something like a special project that has a lifespan, could be a potential candidate, and that would work. The other thing is, yes, we want to make it so it's useful for Palo Alto residents, But I think the earlier comment about something that related to city work or city activities, we're still not a direct provider. So we really must rely on the providers and the community-based organizations and the partners to deliver these things. There may be an instance where there may be something that we could do in our own policies and that kind of thing, but I think our real key to success here is helping to leverage the funds through the creative recommendations and applications from our partners and other parties that may be eligible. I like the comments earlier about looking at some of the community foundations in terms of their process for review, just as a way to kind of get a sense of that. And the earlier comment by Amy, I believe, about the county's work, the Older Adult Summit, and there's also other work in terms of their process. So I'm big on picking and choosing from other practices that make sense. And we don't want to make this overly burdensome for the applicant or for the staff and the people reviewing the applications, if that's the way we go. So those are my comments. Other comments?
I would just add that I'm intrigued by the Measure A process that Santa Clara County used. But I was on the grants committee for the Palo Alto Community Foundation for 3 years, I think, and that's the committee that reviewed the roughly 100 applications we got each year for the 30 to 40 grants we could give out, and it is time consuming. And the committee did break it down. I didn't review all, I didn't go out for 100 site visits, but I went out for 10 or 15 site visits a year. Right. And if we get anything like those numbers, and I think we will, it'll be a time-consuming assignment for the council if they really want to do it in the same way.
Are you saying, though, that there may be elements of that process that we could perhaps utilize? I mean, if this is a process that works.
Yeah, well,
okay.
We have guidance from the county. We have the Community Foundation has been doing this for quite a while. Palo Alto Weekly has been doing something along as well with their holiday fund. So we're not inventing anything here. Right. But I think that if we can really do a good job, it does take time.
Okay, so yes, go ahead.
I think one of the things we talked about up front was whether we wanted to go with an open competition or whether we wanted to define 3 or 4 areas. And I think it would be beneficial to identify 3 or 4 areas that we think.
I would agree with that.
Yeah.
Mm-hmm. It sort of reduces the size of the universe a little bit.
So maybe we each ought to suggest a couple.
Sharp already did with the seniors.
Yeah, I agree with seniors. I think homeless and access to care might be 3.
I wouldn't support homeless out of what we're looking at here.
Health and safety.
I would not support the homeless.
I would like to, I think we should broaden it from seniors to maybe as you come forward, you can add this as an option, is the issue at Lucille Packard and some of the needs assessments issues there.
I would support that.
And I think that's important. And mental health, for example, is again the whole range, and there may be some targeted projects that make sense. So I don't know how my colleagues feel about that, but I think we should cover sort of 3 or 4 areas, 5 areas, have that discussion, and then finalize what we're doing and where we're moving, in what direction we're moving at the next discussion.
I would just offer one other thought. I would say Stanford, but you basically said that. Oh, Packard. That was basically what I heard from you. You want to give it a senior program. So there's still a. Right, so that's fine then. So
yeah, it's one of their 3.
I mean, I wanted the 3 of you to That's sort of how I would break it up, frankly, is use Avenida, Stanford, and Lucille Packard.
Right.
And let's focus on the programs that they have.
Oh, no, I don't agree with that. I want, if there's some creative program out there by a new nonprofit that we never heard of, I want to have them be able to apply.
A lot of work.
Yes, it's a lot of work, but it's
That's
also
the
unfair.
subcommittee you're on, right?
Yeah, no, I mean, I think we should make it more than just partners that
Yeah,
we've
yeah,
identified.
yeah, no,
And look, the best will rise to the top. Do you have enough information now?
Yes.
Yeah, good. I think we gave.
Till the next meeting.
No, I think we've narrowed the field considerably.
Yeah. No, I appreciate people's comments, thoughtful work. Thank you very much.
Thank you, Minka.
All right, now we're on item 4.
I move to continue.
Second.
No? I think the clock speaks for me.
It's only 8 o'clock.
8:10.
3 hours and 10 minutes into the meeting.
Okay.
I guess the question is how long is this going to be?
Depends how long people talk. Okay.
How smooth do we do it?
What do we
Pretty
have?
simple here, right?
It doesn't seem like a big discussion. The question is, do you want to basically have a motion to go into closed session or not? I mean, it's not a huge discussion. It's you're either going to vote yes on it or no on it. And if you vote yes on it, great. Vote no on it, great. We can still move it to council and we move forward.
That's your proposal.
That's,
Your proposal is we go to the San Francisco process, is that right?
no, my proposal is simply that we have a vote before closed session. And say we're either going to go into closed session or we're not going to go into closed session. That makes people think about it. It's not that onerous. It's not that we have this huge model of the San Francisco process, which I guess Molly could explain to us. It's simply that we take this baby step and say, let's think about it before we go into closed session.
I have a question. Are you saying that without any criteria, without any kind of guidance or anything, it's just a gut based on our individual views of the topic in terms of appropriateness for open or closed session?
Well, what
Comes up, we're going to have a discussion. It'll be in the public. It's a discussion of do you want to go into closed session or not?
So if I understand it, so first of all, we're not going to change the definition of closed session and why one's allowed to go into closed session. So right now, we just put something directly on the agenda, and essentially, for the most part, your practice has been you go to that session. So what I understand, at least the simplicity of just the way Councilmember Sharp is describing it is would the council, would we agendize an explicit vote or decision by the council to go into the recommended closed session that we've placed on the agenda? And it both lets the council vote on it, also gives people the opportunity, presumably, to be able to make comments or whatever about, whether they think it's a good idea or they don't think it's a good idea. But it's pretty much limited to that. I mean, it's not a question of, we're going to depend on Molly to advise us that this is permissible under the laws of the state to go into closed session. The real discussion is does the council want to, does the council want to go into closed session or choose or want to discuss having potentially an open session?
So let me address this. I think what I've heard from Molly is that on almost all items, it's a choice of whether or not we want to go into closed session or discuss it in open session. There are certain items, if they're health matters, if they're personnel matters that deal with individual people, those have to be discussed in closed session. If we want to do Jim's review, for instance, I don't believe that can be done in open session. That has to be done in closed session. But right now, I guess you could waive it. But right now, our policy is the opposite. What happens is we show up and we go into closed session unless someone makes a stink face about it. And it's, and it has happened. I mean, we've had a vote not to go in, for instance, on Beverly, and we had the vote to put off going in on the professional. I think that's a bad approach. I think it'd be much
better to say, take the vote and let's think. I see no real downside to doing it. Almost always we'll vote to do it, but at least we'll be thinking about it. We won't be caught unaware, and it won't look so weird to the public that it's this huge issue if something does come up. Like, it was awkward on Coverly, I don't know if you recall, when we decided not to go into closed session.
I have a question, and this would be without the benefit of the staff, without the benefit of having us ask the staff the reasons why they recommended it be closed session or not. It would just be based on our individual views of the appropriateness, correct? It would be without any input from the staff regarding why they originally recommended closed or open or whatever.
No, I
Oakland.
don't think so. I think that you would basically be like anything like we have now. You, as a council member, can say, I move that we don't go into closed session. We have that ability right now.
Yeah.
And at that point, I can say, or some other council member can say, why do you think we should go into closed session on this? With Molly's answer, it's really not Molly. Molly's going to say, legally, you can go into closed session because I've scheduled this. And legally, you can choose not to unless it's one of those rare exceptions. And then Jim can make the argument about why he thinks it should be into closed session.
Right.
Or the pros and cons of it.
And I would just add one piece to that, though, which is there could be situations where, I mean, first of all, it meets the legal test. The law of the land, following the Brown Act, allows us to go into closed session. There are many communities that don't even have this debate. They say it's impossible, and they just go into the sessions. We're in some ways having a discussion about there may be times we want to apply our own standard beyond the Brown Act and have an open meeting discussion. That said, there could be situations where we've asked the council to go in the closed session where our ability to explain at the public open meeting why we think it's worthwhile to go in the closed session might be compromised. And so we have to have some venue or avenue as an outlet. I mean, obviously one is potentially the city attorney has the opportunity to send the council a confidential memorandum, but that may be something that has to happen after the fact.
But you can say that as well. I mean, I think that's a perfectly good response to a council member and say, it would take litigation. I mean, I have a hard time imagining that council members can say, let's not go into closed session on this litigation. You would just simply say that that would compromise the ability, you know, can't have that discussion because it would compromise. And most council members are going to vote the right way.
Thought about this when this was on the agenda, and I think there have been 2 occasions over the last 6 years, 200 closed sessions, where there was a question going into closed session. You mentioned Coverly, and I recall that one, and the 7.7 acres. Now, you know, this wasn't litigation or personnel matters. I guess one was a real estate, and the issue I had in getting in there was finding out, you know, something about the property I had no idea about. So walking in blank, and it would have been very helpful to be able to ask beforehand, gee, where is this 7.7 acres? On the Coverly one, I think there was an issue there of whether we had a commitment to have a public meeting. We had promised a public meeting before we went in to start negotiations. So, you know, those were special circumstances, and it would be very helpful maybe in a circumstance like that to be able to have a little 5 or 10 minute discussion about our understandings before we went in. So, you know, that's 2 issues out of 200 closed sessions.
I have a third.
Okay.
I moved unsuccessfully to have the interviews with the finalists for the city manager position in 2008 be open to the public.
There you go.
And I've made that on a couple other recruitments. And I've gotten 2 or 3 votes, but never more than that.
Yeah, so it would be good to have a formal process where it's easy to raise a concern like that.
Since we've gotten into this, I don't think it's anywhere near as simple as you think it is, Greg. I'll vote in favor of it, mainly because you've already fought. But I think by having raised the issue, you've now encouraged future council members to vote no.
But you need 5 of them.
I know, but there is, people quickly learn that there is an advantage sometimes in being the sole no vote. You can be a hero.
You wouldn't know anything about that, would you, Greg?
No.
No.
There's no advantage. No advantage.
No, Gary Fazzino was the master of this, and Gary, I frequently mentioned it, when he became the senior person on the council. Now I'm the adult on the council, and I can't do any of these no votes that just make me look good, because I know the rest of you are going to bail me out. And I think that you've done, and it's the cat's out of the bag. I think that you're going to encourage future people to vote no on a closed session, even when they know it's the right decision, because they can get publicity.
I guess that doesn't concern me. What concerns me, though, is people might start asking questions and giving talks, and we add 15 minutes to every closed session.
So I don't know what you're going to, I guess I'm going to vote no, because the process is already there.
Is that true? Before every closed session, someone could call for a vote?
It's permissible to do that, yes. As has happened, you've cited a number of instances, and that is permissible to do it that way.
So, but it's not easy. So what actually happens is people actually don't even show up most of the time before the closed session. You get 5 people there. It's not a formal process. People are standing around. And, I had to wait to raise my issue the other day until we had more than 5 people.
Yeah.
I had to hang out on the side. I mean, that's not appropriate.
But wait a minute, you can't go into a closed session until you usually have closed sessions at the beginning of the meeting. You can make your motion also at any time. You could make it at the beginning of a meeting when obviously all of the council members are there.
I'm just saying they're not there. So what happens?
No, they
don't
are.
show up.
Anyway, you can make the motion.
Okay, I will make the motion that we do have, formal approval of the closed session.
I'll second it.
The idea here is it's already permissible, but this makes it official, and I think it makes it more comfortable if someone does have an issue of concern. I don't think there'll be many, and it will be a pro forma in most cases.
And I agree with Councilmember Schmidt. I'll also add that it becomes transparent. The community then understands what we're doing. And there's a lot of value to that transparency, is that they're not surprised by it. It's not an unusual process that suddenly someone says that's not going to closed session. That when it does happen, people expect it. It's a formal process. And sometimes we may actually even be an advantage in that. It may be a close call, like Coverly, where the city manager and the city attorney agendize it for either or, which signals to the community and to Janati and to other people that show up at those meetings that we may actually have that discussion. And I think there's lots of opportunities where otherwise you're never going to have any of that. It's always going to be a shock to everyone.
It can be agendized that way?
It can, and in order to actually hear an item in open session, it does have to be agendized as an open session.
At the same meeting.
Yes, otherwise you can put it over for a future meeting. So it is permissible to agendize it as both a closed and an open if there's some question as to what the council wishes to do, how they wish to handle the discussion. It's not legally required, but what would be good in a situation like that is to put a note on the agenda indicating to the public that one or both of those sessions may not occur. Sometimes they both occur. Sometimes the council will meet in closed session and in open session on the same item.
Induce people to come to a closed session. So it should be clear, clear statement that this is a possibility.
I would just, for the record, because I think this has been misrepresented in the zeitgeist conversations in the past year and a half. Ultimately, any decision that we're going to make for which we are getting direction to explore an issue in closed session as required by law only subsequently gets effectuated by a public decision and action by the council. So this idea of having it on the same meeting makes the things look very, if you had them agendized on the same meeting, makes them very, I mean, they're in the same time. What often will happen, of course, is you would have a closed session, and then 1 month or 3 months or 6 months later, that sort of comes to pass ultimately, and we're back for a decision. So I think it is important that the public does understand that you're giving direction to your staff who ultimately are working on issues that are going to come back before the council and have to be acted on in public.
I would just add that.
Well, okay, except litigation and some personnel, but yeah.
I think this is a
I don't think there's any doubt about what.
solution in search of a problem. I don't think there is a problem. I'm thinking back, I don't think I've ever gotten a question in all the time I've been on the council as to, why did you guys have meet that in closed session?
7.758.
Yeah, the grand jury.
That's not the same thing at all.
Yeah.
So I think that the solution's already in place, been in place forever, and changing it, I think, will have a problem of unintended consequences.
I concur with Councilmember Klein's comments. I will not support the motion. Okay, take a vote.
Take a vote.
2-2.
2-2. Okay, thank you for coming back. Thank you. Okay.
I'm way past my assigned time, and I know we only have one item. How much time are we expecting to spend on item number 5?
Well, and I know Harriet's been sitting here waiting very patiently.
patient, but,
I think we can blast ahead. If people are okay?
Well, not too much time.
We're going
Okay.
to take a little bit of time on the future status, the policy status. We'll take 15 minutes.
I'm leaving at 8:45. Come with me.
Okay, so what time is it now? It is
8:28.
8:28, and let's complete this. And thank you for joining us. And this is Auditor's Office Quarterly Report as of September 30, 2014.
Got 5 minutes.
Yeah.
I'll try and go quickly. Good evening, Madam Chair and members of the committee. Harriet Richardson, City Auditor, giving our first quarter fiscal year 15 quarterly report. Just some quick updates. The franchise fee audit. I'm not going to read everything that's here. I'm just going to give you some highlights of things that maybe aren't on here. Franchise fee audit, there's 3 objectives. The first one is being done by a consultant, and the other 2 are being done by our office. We are very close to having the second 2 complete, and we're actually putting those on the Policy and Services agenda for December 9th. The first part, they're having some difficulty getting all the information they need from Comcast and AT&T, the two franchisees. And so that one is going to be completed later, but we wanted to go ahead and bring as much as we could to you this year on that one. So that one will come in 2 parts. The audit of utility meters is very close to being completed. The report's being drafted. We've also put that on the agenda for December 9th. The parking funds audit fieldwork's about 75% complete. I'm expecting that we'll end up presenting that in late January. And so that's just where we are on that one. The National Citizen Survey, I want to make one correction here that I will would like to incorporate into the motion. I cited that there were 1,111 residents who responded. That number is actually supposed to be 796. When I put that number in there, we have received the raw data. They numbered everything, and I looked at the bottom number, assuming that was it, not realizing they had a gap. So they numbered the people who responded with paper surveys. Then they started over at 1,002, some odd number for reason they used that number, and counted the rest of them that were online. So 692 paper surveys, 104 online surveys. That was 27% response rate, which is 2% lower than last year's, but we had broader coverage because we issued 3,000, we mailed out 3,000 surveys this year instead of 1,200. So
that's a much higher number. number of returns.
Right. So we're looking at the data right now. We have the raw data. We won't be complete with reviewing it and summarizing everything we need to do to bring it to you this calendar year, so that will come in early January. We are planning to present that separate from the performance report so we can get this information out as soon as possible. I did want to comment that we made some marketing efforts, but it didn't increase the participation rate. So that was just good to know if that would help, but it didn't. Sales and use tax, the numbers are there, $31,699 in sales tax and use tax recoveries for the quarter. Our quarterly reports, as usual, are published on the Office of the City Auditor website, and we've continued with our ongoing advisory roles. During the quarter, we received 2 hotline complaints, and we closed both of them out as being unsubstantiated. Both of them were referred to the People, Strategy, and Operations Department for investigation, and they came back with both of them as unsubstantiated. One change that I want to point out that we will make on the next quarterly, beginning with the next quarterly report, since the council approved the Muni Code changes last night, that means that in the future, the departments will be reporting directly to Policy and Services Committee on the status of their report. So instead of us coming with our annual report, what I'm planning to do is add a section to each quarterly report that would give a summary of the overall activity during the quarter, as far as number of audit recommendations closed during the quarter and the number remaining open. And then for each audit, I'm planning to put like a little table that just says how many haven't been started, how many are in progress, and how many are closed, so that you can see the status just in a quick number for each one, as well as expected completion date. So if you have any other ideas on how to present that, I'm open to suggestions. So that completes my presentation for now, and I'm open for questions.
Okay, thank you. Colleagues, do you have any questions?
Yeah.
Councilmember Schmidt.
Just a couple comments. The 2 reports coming in December.
Yes.
You know, I have to admit I'm not on the edge of my chair about either one. You know, the parking one looks important, exciting, but just as you think through future identifications of issues, doing franchise fees and utility meters, you know, might not have the biggest payback.
I will mention that the utility meters audit was the result of issues they identified during the inventory management audit. So I think it might be more interesting than you think.
Okay. I was going to mention the National Citizen Survey. The numbers are higher, and I think that's good news. And on the last page, we now have had, 12 complaints filed, but there's no idea of what they are. Would it be any use at all? I know the police department reports categories of events. Can you give us some sense of categories where these fit in?
I would say that most of them are someone complaining about another employee, some things like how they use their time. And most of them, when you go in and look, you can't find evidence to support what's saying it. And I think that's the hardest part with these, is there's a lack of evidence to support that what the complainant is alleging actually occurred.
Yeah, I'm not so interested in the solution. It's just, you know, what categories are they? Personnel or sexual orientations, or, you know.
And I would say the majority of them are personnel related.
Okay. Thank you.
Other questions? Okay, thank you. Thank you for your work.
A motion?
Let's see, how's it read?
Recommendation to council for acceptance?
Yeah, I move that we send to council.
Second.
Okay, all in favor? Aye. Opposed? Passes 4-0. Thank you.
Thank you.
Okay, we wanted to go over very briefly, the status of items. Cash, thank you for updating this, and we've talked a little bit, but do people have questions, concerns? Okay.
So we had the issue of the minutes. They were supposed to come back to us.
Oh, yes, yes, yes.
I don't see this on here at all.
I'll add it, my mistake.
I'd like this to come back.
The issue of the minutes, okay.
I mean, I thought it was just a matter of people wanted to hear, I don't know what the nonsense, Donna didn't have much stuff. I thought we had most of it, we could wrap that up.
That's right.
Okay.
I think there are 3 committees that do verbatim minutes. The PTC, the ARB, and the Parks and Rec. Each now have verbatim minutes. So we should get 3 reports on the cost from 3 different places. And yeah, I guess we wanted to get that on as soon as possible.
Okay, yeah, I'll check in with the clerks to see how fast they can get the report together and get it to you.
I'd expect they'd be able to get it.
Yeah, I can check with them. The 11-13 meeting has several items on it. We're looking at 6 items, or 5 items as of now.
Well, I'd rather go down to the amendments with fire code.
Okay. Okay.
That would be that onerous.
So it's lucky we did the close.
Yeah. Oh, that's true.
Questions? I had a question. You and I talked about the amendment of the municipal percent for art policy, and what did you say about the status of that? Because we have 11-13, we have 12-9, and I've asked the city clerk's office to do a doodle for a potential second meeting in December if the agendas suggest that's necessary, and that would be December 3rd or 4th.
December 3rd at 6 p.m.
Is that the one that came through?
That's the one that we're doing.
Correct, that's the one we're doodling for, I believe.
Okay, that's a Wednesday?
Yeah, I believe 2 council members have responded yes.
Okay.
Forget which ones, though.
I don't think I've responded yet.
Okay, so we're.
I don't remember getting the
It's
full
kind of
response.
it's a placeholder.
Yeah.
Because we may not need it, but, so the question was the municipal percent for art. What's the status of the preparation for that?
I think it could come back to you in November or December. It's it can come back. It just the schedule's looking so full. We didn't think it was that critical to bring it. So.
Okay. Do people have a preference?
January. I'm happy to do December because November looks pretty busy.
Okay, December, and we may have a second meeting if we need, if we don't need it, we won't have the December 3rd. Okay, but let's have a placeholder for now. Other questions?
Yes, I'm sorry that Molly had left. I'm talking to her about zoning implications of the online Airbnb companies.
Yes.
Potentially violation of our zoning codes.
Hillary said she won't be able to get to that till April.
Yeah, Hillary Gittleman said it's on their work plan, and they will not make enough progress on it to bring it forward to us. That's what she said.
I find that unbelievable. I would like to have it on our agenda and find out why.
Okay.
This is not a huge assignment. I've been following this issue because it's so intriguing.
Right, right.
And I read about what New York City and New York State have been doing, and it just boggles my mind that they couldn't get to it.
Cash, would you check on,
Yeah, I'll
let's see
check
if we
on
can
that.
get it on, well, I would say at this point it'd have to be December.
Yeah, just to clarify, it is the item on page 2 of 3, the implications of online travel companies?
Well,
or is it?
No, it's, wait, where was that?
That's on-
It's the second part of it. We've taken care of it.
Oh, this one, yeah, it is.
It's not,
Okay.
we've done the transit occupancy test.
Okay.
portion of it.
So it's the
Now
policy.
question is whether
people are in effect violating, are they running a hotel in an R1 neighborhood?
Okay.
I don't know the answer to that, but I know that this has become a problem in other portions of the country.
Yeah, it has.
Renting your house two-night stands over a 6-month period.
Yeah, I'll check in with staff and see what we can do. Correct, yeah. Yeah, sure. Correct. I'd have to check in with them. I did see the REV consultant here today, and he was meeting with staff, so I don't, I didn't get a chance to check in. Yeah.
Any other comments? Well, I asked you the issue of the airport and the recruitment. Those two items I don't think are big deals.
Check in with them.
People concur.
Okay. I'll check in with folks to see what.
Make good progress on a
Yeah.
lot of items.
Yeah.
Okay. Any other